Test, 1, 2, 3, test. is this one? We're good to go now.
Hello, I'm Ellen Herman. I'm the Administrative Director over at Watkins Health Services. Thank you for having me today. I'm going to do a little rundown on all the things that we've been working on, and then we'll talk about the fee. So just so you all know, HERO, which is the Health Education Resource Office, they still fall under our budget. So I'm presenting for them as well at the same time. So we're the health center for KU students. Studies have shown that when someone feels better, they do better. So Watkins plays a critical role in the success of KU students. Students can utilize the health center for both sick and well visits. Our focus is to provide high quality, affordable student health care that supports the Jayhawk learning experience. The Health Education Resource Office, and I'm sorry, I'll have to read their section. It's not my department. They support students' personal development and enhancing healthy behaviors. They use a holistic approach. HERO promotes the 8 dimensions of wellness so students can thrive personally, academically, and professionally throughout their college experience and beyond. Through collaborative efforts, we're committed to fostering a campus culture of health and well-being to support student success and build a healthier KU community. HERO provides various prevention-based programs, personal coaching sessions, presentations, outreach, and events available to all students to help them reach their health and wellness goals. HERO's main topics of concentration are, well, they have 4 main topic areas: alcohol, tobacco, and other drugs, mental health and self-management, nutrition and food security, and sexual health and healthy relationships. Student engagement and involvement is a huge part of what HERO does. All these services are offered by HERO, are covered by the wellness fee, so there's never a charge to participate in any of the HERO programs. Both of our departments have student employees, so I wanted to talk about those briefly. Watkins employs 16 health navigators. Those students work at the front desk of Watkins. They typically have an interest in going into a healthcare career. They answer questions, greet visitors, and give directions within the building. So that gives them a nice entry-level exposure into healthcare. We also employ 15 pharmacy students. 4 of these students are clerks. They're typically pre-pharmacy or pre-med students. They can run the front counter and answer the phones. 11 of these students are pharmacy interns who are licensed by the Board of Pharmacy, and they can perform most of the duties that an actual pharmacist can do. HERO employs 5 peer health educators. They work alongside the health educators in creating, implementing, and evaluating education programs, events, and presentations. HERO also supports interns and practicum students to work, observe, and shadow within the department to enhance their academic experience as well as fulfill program requirements. That means we employ a total of 36 students over at Watkins, between Watkins and HERO. Watkins does have a carry forward that we need to reserve for large projects that would not be covered by KU. In the past, we've used these dollars to help fund replacing the roof, replacing heating and air conditioning systems, major remodeling projects, offset the cost of an aging radiology system, which was upgraded in recent years, and offset this is a new project that I'll talk about later, but it's to offset the cost of transitioning our radiology reads over to the health system. Additionally, we're required to keep a surplus of funding that would sustain us operationally for 90 days should the need arise. We all learned over COVID that surplus is crucial. So for the last 6 months of 2025, we had 15,935 encounters with students. Of that number, 12,926 were visits with medical providers, or 81%. So you can see that the medical providers actually have the majority of the encounters with students at Watkins. For fiscal year 25, we had over 30,000 encounters with students, and 81% of those were visits with medical providers. So our ratio is staying pretty much up to the trend. And then of this total, 12,828 were unique patients to us or students. In the year prior to that, we had almost 30,000 encounters with students, and 80% of those were visits with medical providers, and a little less unique patients that year. Hero doesn't have the ability to track unique encounters. However, they do track overall encounters. So in fiscal year 25, Hero had almost 30,000 total encounters, and they're broke down as follows between student engagement, student involvement, student leadership. As far as our finances goes, our overall salaries increased by almost $200,000 this past year. We anticipate another increase in October. Our physicians need a salary increase during this fiscal year or during the next fiscal year to allow us to successfully recruit. We have a long-term physician that's retiring in December, and in order to recruit a replacement for him, we're going to need to increase all of the physicians' salaries slightly to so that we can actively recruit. And their salaries are still out of balance with what they could make in the community. Another issue that we have is there's a shortage of medical assistants in our area. We have to cross-post positions for a licensed practical nurse. If we end up hiring an LPN to do that role, there's a higher salary, but we also can't work short staff. So the reason is that a couple of schools in the area that offered medical assistant training programs closed down. And so most of the schools that are putting out medical assistants are in the Kansas City area now. This year we did another bulk purchase of IUDs. When we do that, this is our third year in a row of doing the bulk purchase. It allows us to keep the price of the insertions the same for the students, but then we have to front the $100,000 that it costs to bulk buy the IUDs. We'll get that money back over the next 2 years, but we don't get it back until we actually do the procedures. The reason is we want to keep the services as low priced as possible for the students. And if we don't do that, the increase would be about $250 per procedure more for the students. We do operate under our own budget, and our staff are employed by the health system, so we have not been affected by the KU hiring freeze. I know that was one of the questions on the questionnaire. And there's still some positions that are open in our budget that we're recruiting for and haven't been able to fill yet. So those are placeholders that we still need to account for. We do have a couple other sources of funding at Watkins. Our wellness fee accounts for 71% of our revenue, and 29% comes from ancillary services that we do bill for. This ratio has remained similar, very similar for the last several years. The ancillary services that I'm talking about that we bill for are lab, radiology, pharmacy, and some procedures that we do in the clinic. Some other sources of funding that we have a small faculty staff clinic in which we bill for office visits. This is a very low utilization. We may see 10 or less patients a week in that clinic. We do bill for those visits, but it's a very low source of revenue for us. Having physical therapy and sports medicine in-house, for those of you who don't know, we lease space in the building to LMH Health. This allows them to run the physical therapy and sports medicine clinics that are in our building. We don't get any revenue from their services. They do all of their own building, but we get revenue in the source of rent. And the reason that's important is it goes into a different fund than our operational budget, and that allows us to purchase equipment and things that we need outside of our operating budget. So that actually helps you, all the students in the long run, that it's not coming out of our operational budget. We do teach BLS courses to internal and external departments. We recently highlighted this on our website, and that business is a little booming right now. It's hard for that person to keep up with it, but that's a small source of revenue for us as well. The wellness fee is the only source of income for Hero. Hero has received grant funds specifically for the Jayhawk Buddy system. However, those funds are never guaranteed. We also have a maintenance fee, and in the past, we've used the maintenance fee funds for the following expenses, like new flooring and paint in the physical therapy area, new paint in the lab area. We needed to switch some doors to ADA, and we did get that using those funds. We also had some rooms that had formerly been areas where people could wash their hands and things, but we were using them as storage closets, and they weren't opened every single day. So you could easily have a leak back there and never know it for a while. So we had the sinks removed from those areas. Also, 2 years ago, we put some cameras installed outside of our building for increased security. We don't anticipate any major costs in the future, but we do have a very old building. For anyone who's been there, it's a very old building. And we have to plan for repairs at any time. We continue to have issues with very cold exam rooms and offices on the west side of our building. We've been working on that issue for about 3 years now. It's still not resolved. So we do have to constantly readdress that problem. So our wellness fee, the health portion of your wellness fee at Watkins, covers most office visits with a medical provider. They're at no cost and there's no copay, including physicians, nurse practitioners, our athletic trainer, psychiatric nurse practitioners, and social workers. There is no limit on the number of frequency or visits. So a student could come every single day if they wanted to, and we don't charge for those visits as long as their wellness fee is paid. You all had asked how much those services would cost in the community. And the average would be about $185 to $400 per visit, depending on what type of provider you were seeing. The wellness fee also covers significantly reduced fees for a majority of our services, including laboratory, imaging, and pharmacy. And I'll give you some examples there. A chest x-ray at our clinic is $117. That includes the radiology reading. If it was an outside provider, you could expect about $432 for the same x-ray, along with a $100 to $200 bill for having a radiologist read it. So you can see that's a significant savings. We do the fourplex testing in our clinic, which those of you who don't know, that's the COVID, 2 flus, and RSV testing. It's a swab. We charge $97 in our clinic, and it's about $165 in the community. There's a list of some pharmacy items. Our price is first versus the CVS price second. You can see there's some pretty good savings, especially on things like Zyrtec and Claritin. So allergy meds seem to be a big deal. Pretty big price difference. Under the wellness fee, we also do management of compliance for university policies, meaning we're in charge of all the vaccine requirements. It has been alcohol at EDU. I understand that's changing next year. We're also part of the emergency response plan for campus. And then all services offered by Hero, as I mentioned, such as their health education programs, animal therapy, wellness fairs, et cetera. Those are all covered under the wellness fee. For customer experience, we've done a lot of work over the last couple of years to improve the customer experience. What we've done is focus on the total customer experience rather than just on customer service. That means we're looking at everything. We want our staff to be nice and friendly and helpful, but we also want the building to be clean. We want to have the right appointments available for students. We want to make sure that we have the right medications in the pharmacy. It's the total experience for the patients. We hosted 13 flu and COVID vaccine clinics across campus this past fall. That means we brought those clinics to where the students were. We continued our Watkins Patient Assistance Fund. We've helped over 400 KU students with more than $17,000 in unexpected medical expenses since that fund was started. We've made improvements on continuity of care for students. That means that if you came in one day to see somebody and you're not feeling better, you come back a couple days later, we try to get you in with the same provider. We continue to improve the walk-in patient experience. Right now, our walk-in patient ratio is about 50%, and the other 50% are scheduled appointments. So a few years ago, we measured this, and we decided we would love for 80% of our walk-in patients to be in a room ready to see a provider within 30 minutes. That is unheard of in the outside world in healthcare. I track this every year just to make sure we're still on track. And we are currently tracking it now, and we have not fallen below 91% since we tracked it. So we are getting students in and out of there with few exceptions. We continue our quality improvement program with ongoing projects in multiple departments. We always want to make sure that we're giving the best service to the students. We also survey our patients every October, November, March, and April. That doesn't mean we survey all the students. We see the students who we're seeing during those months. They get an invitation to complete a survey. Once they complete those surveys, we share feedback with our staff. Our customer experience committee watches for trends, and then we tackle those with solutions if we see some kind of trend that we need to address. Just some highlights from our most recent patient survey results, and this was from the fall. Typically, we don't know why, but once we include our spring results, our numbers usually go even higher than this. But overall satisfaction with the visit was 90%. How likely you are to recommend another student to the health center was 86%. That my provider listened carefully to my concerns was 89%. And provider accepted what you said without judgment, 93%. I like to share a couple of comments that students give that are just kind of, to me, they're not specifically to like lab or radiology. They're just more in general of the whole health center. One of them said, kindness, understanding, and judgment-free environments are critical to the health and safety for the patient. It fosters honest communication and a safe environment for proper treatment. I love Watkins. And then I appreciate the time the doctor took to understand and prioritize my well-being over what someone or society might think. He cared about me as a person and a student. We read every comment, so if you ever get a survey, please give us your feedback. I'm pretty big on process improvement, which if you all haven't heard, it used to be like Lean Six Sigma or be just known as a Lean project. So we did a lot of projects. We've done a lot of projects in the last 5 years, but this year we did our 3-year reaccreditation through AAAHC, which is the Accreditation Association for Ambulatory Healthcare Centers. Just so you know, only 11% of student health centers are accredited through AAAHC or Joint Commission. It's very rare to have a student health center be accredited, and we're pretty proud of that. It means that we are providing the absolute top-notch healthcare for our students. We worked on improving our birth control procedure workflow. So I talked about those IUDs. Pre-COVID, we were, from the time someone comes in and asks about a procedure for birth control, we were only completing those 60 to 70% of the time. Now we're at 74% of completion rate. So this past year, we did 155 of these procedures. That's the reason we do the bulk buy. 155 students would have been impacted by that higher cost had we not done that. Some technology improvements that I wanted you to be aware of is our web booking. It's always been there, but it's improved now to allow patients to search by day, time, or a provider that they want to see. We recently transitioned our TB questionnaire for domestic students into our internal health record. It used to live over on the enrollment side. And in the past, if a patient saw a handout that we gave them through their portal and they dismissed it, they could never get to it again. So now you can still go back and view those later, even if you dismissed them from your portal. And we launched a patient portal for our faculty and staff clinic. That was to meet some legal requirements. Patients have to have access to their records, and we have not made that transition yet. We are currently working with the health system on assuming reads of our x-rays. Right now, we have a local radiology group that reads our x-rays, and I'll just briefly tell you why we're switching. We send them over a file through the cloud once a day, and that's around noon every day. So if you came in the afternoon and had an x-ray done, it wouldn't be read until the following day. We don't want to miss anything. We want our students to have the best possible experience, and the health system will read the images in real time, meaning we would get results just as soon as they're done reading them, they'll come to us. And so we know that this will be a better experience for anyone coming in to get an x-ray. We hope to have this completed in April, but we've had a little snag, so I'm not sure that it's going to happen by then. But we did request for the health system to keep the pricing the same for the students, and they agreed to honor that. So that was a big bonus. We continue to monitor inventory in the pharmacy and utilize all 4 of our primary vendors to ensure that we get the best pricing and product. Some other projects that we are working on or have worked on. We continue to do, this is under safety, we continue to do our suicide screening questions at all patient appointments. So it doesn't matter if you're coming in for a sore throat, a twisted ankle, or a mental health visit, you will get screened by someone when you're being roomed for a provider. Our second social worker started in February of 2024. So back in 2023 to 2024, that's the number of positive suicide screenings that we've had come through our clinic in a very short amount of time. 72 of those met with social work and 21 were referred for services. The following year, we had 102, actually that's only a 6 month, or basically a 4-month period of time. 102 met with social work and 34 were referred for services. So that's a pretty big trend upwards. In 2025, we had 1,494 positive screenings. Of those, social workers met with 296 students. So you can see the trend is still going up, and definitely a big need for having that second social worker. We placed posters in all of our restrooms to direct people to resources if they feel unsafe at home. So we decided not to ask that question during our visits because we don't internally have the resources to assist if somebody said they do not feel safe at home, but we wanted them to still have access to resources. So since we put those posters up about a year ago, there's only been 8 total clicks, but we've had 4 in October and November. So it seems like maybe people are noticing them now and getting some attention. We purchased, I do need to update this line. Sorry, I didn't get a chance to do that before I sent it over, but we purchased locking medication bags that we will give out free to students who are at risk for overdose. So our social workers will give those locking bags to those high-risk students. Under service, we do have physical therapy and sports medicine, I mentioned. Those 2 programs continue to be very, very strong. In fact, physical therapy went from having 1 person 2 half days a week to now they have 1.5 people there all the time. We did have some remaining Healthy Blue Grant dollars to help with some flu vaccines again this year. Those were for students that didn't have insurance. We switched to a better translation service that allows for video calls rather than phone calls, and we can get somebody within a matter of a minute or less on the phone for translation. Some financial projects we've worked on, some prescription drugs are reimbursed by insurance at a loss. This is everywhere. Those big pharmacies can absorb it. Our little Watkins pharmacy can't absorb it. So we have to make up for that somehow. So we raised a little bit of the pricing on over-the-counter items to compensate because you saw how low the pricing was anyway. So we just adjusted them a little. Probably you wouldn't even notice. We continue to monitor. We also started a contract with a vendor called Save More. What they do is they make sure that we are getting, that's a nationwide vendor, but they make sure we're getting the best pricing on medications. They also go to bat for pharmacies with insurance payers to make sure that everyone's getting the best reimbursement, not just us, but for everyone that they work with. We did enroll in a patient assistance program for IUDs. That means when a student has no insurance coverage because the claim would go to their deductible, out of network, or something along that lines, the company will replace the IUD, so they send us another one. That means there's no cost to the student. So when we get that replacement IUD, we do not charge the student for the IUD that they received. We don't receive any type of rebate or refund for those under that program. Some new equipment that we bought last year or this past year using the money that we have in that fund from rent payments. We got 3 new vital sign machines, 3 new label or printers for the lab. Our TempGuard refrigerator needed to be upgraded. That included a test that monitors humidity as well as temperature. And every year we upgrade miscellaneous IT equipment to replace outdated laptops, computers, phones, iPads, etc. This is our proposed budget. I want you to know that we, when I get to the salary page, we kind of budget the worst case scenario. Actually, we do it with everything. And then we work on savings throughout the year. And so our budget never ends up looking as bad as it starts. For our revenue for next year, this would be with the proposed increase that I'll talk about shortly. We would anticipate our revenue to be a little over $9 million. Our operating expenses, this is how they're outlined, about almost $2.4 million. Those are for things like supplies, maintenance contracts, things like that. Salaries is always going to be our biggest expense, a little over $7 million. If you add salaries and expenses together, it's about $9.5 million. And if you go back, you can see we only anticipate our revenue to be a little over $9 million. That's going to leave a potential deficit of $419,000. It is never going to be that bad. We budget all of we have some academic staff that don't work when the students are not here, but we budget them full-time. That's in case we need to call them back to work at any time. Everything that we budget is a worst-case scenario. We're always looking for cost savings. We're always watching overtime, things like that. And we'll continue to do process improvement projects and be good stewards with the finances. So in summary, we're not only are we doing all of those things, but we're always looking for lab tests that we could bring back in-house so that instead of LabCorp getting the revenue, we can get the revenue. Because we're at what's called a point of care lab, there's not a lot of options available, but every year they're looking into more and more testing. And so there's another one that we'll be bringing in soon. Some things for you to consider: our salary costs have increased dramatically. They're always going to go up every year. Our supply and contract costs have increased. We can always count on about 5% every year. Insurance reimbursement has decreased, so I think that's going to be a trend as well. So for this year, we're requesting a $4 increase. We have not, we haven't requested an increase for the last 4 years. We've kept the fee flat on our side for 4 years. Without an increase, we will either need to adjust prices or modify services, and there's no guarantee that we wouldn't have to ask for another increase in future years, just because we don't know what our costs are going to be. Some options that we would have if the increase was not approved would be charging a small copay to see a provider. In addition, just know that we don't love any of these. Charging a small copay to see a provider in addition to the wellness fee, it might be around $5. Reduce our operating hours. For those of you who don't know, we keep people there until 6 o'clock every night. If someone's in the building by 5, we stay and treat them. That does mean that we pay staff to stay until 6, just in case. And when we're done with students, they leave. So sometimes they're done at 5:30. But we are open on Saturdays. And Saturdays might be something that we could look at, because if you've never worked in healthcare or don't know, when people work on the weekends, they do get a premium pay for that. So Saturdays and Sundays are included in that. And even though our staff takes a half a day off during the week when they know they're going to work on Saturday, it's not apples for apples. It's more like apples for oranges, because they get that premium pay on the weekend. The other option we have would be to raise those prices on laboratory tests, x-rays, and pharmacy items that I mentioned earlier. So that's the end of my presentation. So I would take questions.
Great. What questions do we have? Also, let me know if you'd like microphone.
I talked fast.
Thank you for the presentation. And so could you sort of explain the reasoning as maybe why you would choose Save More as opposed to like GoodRx? Like, was there a specific reasoning? Was it a better price that Save More was providing? Could you just illuminate us on that thought process?
So since I'm not our pharmacy manager, I'm going to do my best. There is a reason we cannot do Save More in our clinic, in our pharmacy, short of making our own coupons. So using Save More, they've actually done really, really well with getting us the best pricing on medications, and reimbursement has gone up a little bit on some drugs. It's not going to be on every drug. I would have to find out the specifics on the GoodRx, because I cannot remember what it was. I'm sorry. I know there was a reason.
Yeah, thank you so much for your presentation. I think I have a couple of questions, maybe because I have personal experiences and also other people's experiences when it comes to Watkins Health Center. The first question I would like to ask is, what is the difference between student health insurance and wellness fee?
Okay. So the wellness fee is something that the students pay. It's part of the required campus fees. So that authorizes you to use the clinic. So when you pay your wellness fee, it authorizes you to use Watkins, CAPS, and Ambler Rec Center. The health insurance is going to cover other things. So if someone has the health insurance, most of the students who purchase that plan are the ones who don't have any insurance. So if you use services in the health center, your coverage is really, really good. And that health plan actually has really good coverage. For instance, if you do have the student health plan, you would have a $5 copay on medications in the pharmacy, a $5 copay on lab tests. If you go out into the community to seek care, you would have a deductible that would need to be met, but it would cover you. Because if you just paid the wellness fee and you had no insurance at all, and let's say you had an emergency that we couldn't help you with, or it's after hours, you had to go to the emergency room, you would have no coverage at all. Does that make sense, that the insurance would also cover you outside of Watkins?
Yeah, it does. It does, but
Can you, okay, it does, but I'm still curious about what does health insurance covers within KU, like within Watkins.
Okay, so if you didn't have insurance and you paid the wellness fee would make you eligible to use the clinic. If you also had the insurance, then you would only be paying a $5 copay on things like labs and prescriptions, where if you had no insurance, you would also be paying whatever our full price is for those labs and x-rays and pharmacy items. So like on that fourplex test that I talked about, that's $97. I'm just gonna use that as an example. If you had the insurance, you'd only pay $5. If you didn't, you would pay $97.
If you have any follow-ups, we can go back to you. We'll have some other people ask questions first. Also, we can have 2 mics on at a time. Make sure you say your name if it's your first time speaking. Does anyone have any questions that haven't asked? Let's go to Mia.
Hi, thank you for your presentation. My name is Mia and I'm Vice Chair of Community Affairs. I was just curious, I've seen on your website that under insurance, you do not accept Medicare, Medicaid plans or plans underwritten by health insurance companies based outside of the United States. Could you explain a little bit about that decision?
Sure. So Medicare and Medicaid are government-funded plans. With Medicaid, we would have to open the health center to the community. So if we accepted Medicaid, anyone in the community would have the right to use the clinic, which we can't do. They've made some changes in Oklahoma. Each state has their own rules for how their Medicaid plan is run. And we learned that one of the health centers in Oklahoma has started taking Medicaid because their state changed their rules on that, on opening it up to the community. So I think there's hope maybe that at some point that could happen in Kansas, but since it's state by state, we just have to watch. We have done some things to help the students that have Medicaid. So we don't just turn them away, we still take care of them. For instance, one of the things is that we would still draw their blood if they needed blood tests, and we would just send the test to LabCorp, and LabCorp would bill Medicaid. So we wouldn't just like not treat the patient, we still treat them. And then we don't have a charge for our office visits, so that works out pretty well that someone can come in and still be seen. But Medicare, like outside of the country insurance plans, like if my health insurance won't pay if I'm out of the country. I don't know if you all know that, but most insurance companies won't. But with Medicare, it's just government. It has just some different rules, and that's why we don't have a lot of students that have Medicare. That's mostly for people who are over 65 or have disabilities that make them eligible for Medicare. That's a very small population here.
Sean Lawson, Vice Chair of the Finance Council. So in your simulation file, there's 2 different scenarios there. One of them is a $2 increase instead of that $4 increase.
Mm-hmm.
My main question is just what would be the difference between a no increase and a $2 increase in the impact to your services?
So even if we got a $2 increase, we still might have to do one of those options that I talked about right here. Just because what we were $49,000 over budget 2 years ago and $65,000 over budget last year. So we can see where the trend is going. It's mostly because of the salary increases. So we would have to make up for that somehow.
Thank
Okay. My name's Aiden. I'm serving as a proxy for KHII. And she wanted to know about the Heroes Period project and if that's a student-led initiative and if the dollars paid for that.
The which project?
The Heroes Period project.
Oh, and I don't know anything about that, but Jennifer might. Sure. Sorry.
I'll just come up here.
Okay.
Hi, everyone. I'm Jennifer Wamelink, and I am Associate Vice Provost for Student Affairs. I get to work with Ellen, but I also work with Heidi Garcia, who's the Director for the Health Education Resource Office. And the period project right now is completely funded by some endowment funds that we have through the Pepsi program. So so that's the funding that we use for that. So none of Heroes money or the wellness fee go to the period project at this time.
Good follow-up.
Absolutely.
Is it a student-led initiative as well?
The period project initially, the first pilot, and I'm going to not recall the exact year, was a student initiative. And then it has lived with Hero since then. So they partnered with Hero on the original pilot.
Thank you.
Welcome.
Hi, Ellen.
Hi.
I'm Tanya Singh, Secretary of the Finance Council. I wanted to ask regarding the second social worker. What determines, after a positive suicide screening, whether a student goes and sees social work? Is that a voluntary process?
Yes and no. What would happen is if the student answered yes to one or both of the suicide screening questions, then the provider would likely come in the room, further screen the student, and then decide whether they needed to be connected with resources. A student might already be in therapy. They might already be receiving services, and they don't need us to do anything further. And if the student declines, we always offer them the resources. So if they don't want to meet with social work, we'll still make sure they leave with resources in their hand so that they have them available. But most students are willing to meet with social work.
Go back to Omaha.
Good afternoon.
Hi.
Thank you for the presentation. It's Vanessa with Boston, student university senate. As I am aware from some of my peers who are international students, they pay a fee for Watkins, an insurance fee of approximately $2,000. Why is that amount exorbitantly high compared to domestic students?
I think that's for the health insurance.
Yes.
Yes. So KU has a policy about international students they're required to have health insurance. Did you want to add something or me?
So just that's a policy above that.
Oh, above KU even is the state policy?
Oh, I don't
Like
know
a
about
cable
that,
or-
but it's not.
Okay. Yeah, it's not Watkins.
Yeah, I think a follow-up to that is the fact that I've heard students walk into Watkins, maybe basically international students also, and they've had to co-pay on the services they received from Watkins. And even during summer, for them to receive services, they have to activate by paying a fee before their health insurance is being recognized. So sometimes I try to wonder what services majorly Watkins provide for international students, despite the fact that
So,
they pay all of this.
If I understand, are you saying that they've been asked to pay a fee before? So we wouldn't do that in Watkins. We would know that they're going to have the insurance. So
This
we
wasn't
wouldn't ask them to pay anything. If somebody was asked to pay something, I would want to know.
That happened to me.
That happened to you? Would you get with me after? Okay.
Good afternoon. My name is Frederick Omai, student body president for the graduate students. Thank you so much for your presentation. My question goes to the ledgers that I'm looking at. There's funds of around 2.5 million, roughly, that is either in reserve and or unallocated. Could you please elaborate more on that? On the funds that are either on reserve or unallocated.
Unallocated. So that's that reserve that I was talking about. That, that we generally reserve for like a 90-day reserve, so that if something happened, we have money to fall back on to run the clinic.
Looking at the ledger, there's also still a row for 90 days. It's still there.
So
Or
the
is it
90
just-
the 90-day reserve that Watkins has to have is 2 million. So if you're looking at the simulation file right now, at the
Oh,
5-10 Watkins simulation file, Watkins has a balance at the end, for the projected balance at the end of this year, of $2,033,000. They have to have $2,323,000 in their 90-day reserve to cover all staff and operations for 90 days in case things were shut down. So in case COVID, things don't happen again, COVID happens again, we have a shutdown, they have to have that 90-day reserve. So take $2 million out of their balance. And they're sitting at a negative 289.
A follow-up question is that the divergence in the 90-day reserve funds still looks like it's growing larger and larger, even with the allocation of the extra $4. So is that really a priority, an additional $4? Or?
I think Casey's gonna.
I'll answer that again too. So when you guys are looking at simulation files, it's gonna show up on every simulation file that you look at. The 90-day reserve will always increase every year. It increases because salaries increase, rent increases, so that increases what the budget is, which increases what 90-day reserve is. So every year that 90-day reserve increases.
We'll go to Casey. Casey hasn't asked a question
Right,
yet.
you can chat after, okay?
And try to limit follow-ups unless it's like very, very directly related or if it can answer the question. Go ahead.
Hi, Casey Sobers, Student Senate Coordinator of Staff. Thank you for your presentation. I want to say I really admire and appreciate your guys' willingness and ability not to ask for a fee increase the last 4 years. That's pretty impressive. All of this to say, I was curious, I see you presented the $2 and $4 sort of suggested increases for the fee. And I understand that not getting the full $4 would impact your services to this degree. Oh gosh, I just realized I rambled too long and I forgot where the question was going. That's awkward. Wait.
Come back.
Got it, okay. Let's do it for a second. Oh, wait.
Let's go to me and then we'll.
Yeah, sorry, I need to.
There was.
No, I need that, guys.
Go ahead.
Okay, well, Casey's buffering. I was just wondering, where do you differentiate between what services you offer, presuming that you have the staff and the technological capacity to do so? If I may provide an example, I know that you have an extensive women's health team and capabilities for providing pregnancy tests, STD screenings, birth control services, and that includes the acquisition of a sonogram or ultrasound machine, which I believe you have in-house. I know that they offer IUDs using that sonogram technology as part of it. Why would you not be able to use that same machine to offer viability ultrasounds for pregnant students?
So the ultrasound we bought specifically to verify placement of IUDs. My staff is not trained as a radiologist would be to read ultrasounds that are any more complicated than that. You're welcome.
Let's go back.
Yeah, sorry, I was trying to write it down.
You good? Are you good?
Yeah, okay, sorry about that.
That's okay.
I was wondering, if we were to only increase the fee by $2 in this fiscal year, I see that in the presentation you said this wouldn't prevent us necessarily from asking for increases in the next year. If hypothetically, and I apologize for hypotheticals, we were to increase it by $2 this year and $2 the following year, would that have any impact on sustaining the services like under their current, as they currently operate? Or would the expectation presumably continue to be an annual increase given the rising costs year after year?
So I think that so just in full transparency, we're probably looking at an annual increase regardless. So what happened, I've been here for 5 years now, and time flies. But when I first started working here, we did some really big major projects that saved us almost $400,000 a year in annual savings. We've eaten into that every year, which is why we haven't had to ask for an increase. But now we're to the point where the salaries are just going to continue to consume whatever's there. And so we're going to need to ask for an increase, most likely every single year, unless we find some other major project that we could do. But what I would see is if we only got $2, I think the lesser of the other options would be to increase pricing on like lab tests, x-rays, pharmacy. That would be my go-to if we only did a partial fee. But I would love to not increase anything or reduce anything.
Thank you so much.
I didn't state it before, but my name is Simran. I'm the chair of the Rights Council and chair representative, or rights representative. My question is, you mentioned plumbing issues and the facility being old, and there's been other entities that can sometimes be a huge problem now and definitely in the future. And so could you just illuminate us on those issues and maybe the extent to which it's a problem now or maybe would be in the future?
Sure. You all may not be aware of this. It was either last year or the year before. So it's a very old building. I think there's over 80 bathrooms in that building. So they are not all utilized all day, every day. One day we just had a leak that came from a bathroom and we didn't know where it was coming from. Water was just shooting out of a toilet. So we got facilities to come over, and what happened was the seal in that toilet had dried up. So when they turned off the water to fix a issue with underground in the street, and they turned the water back on, the pressure burst it. We had to call in ServPro to come and clean air out the walls and everything. And they were in there for probably a week with all their air dryers and everything. And then the very next week, another one blew. It was a pretty big deal, especially when they happen on the second floor and the water's dripping down to the bottom floor. So that's why we took out some of those sinks, is just trying to make sure that things like that happen. And we have some of those low utilized bathrooms now that are out of service. We just had them turn the plumbing off in there altogether.
What other questions we have? I can ask one. So you mentioned that kind of facilities and maintenance fee. Just to clarify, is the ask for that flat at $350?
Yes.
Is there any other questions from our committee? Okay. You go back to
You should have thrown it.
These are definitely what they're only
questions, but we should have a lot more presentations.
So a follow-up question to my previous question is, do you have any sorts of, I know previously you had said changes could potentially be negligible for some like price increases, but once again, hypothetically, looking at a smaller increase this year compared to the requested increase, just to give us all an idea of what the inability to increase to $4 could look like for students. Do you have any ideas of what those prices might be for co-pays or increased price, or the increased prices on tests, x-rays, pharmacy items?
Yeah, that's a good question. So the copay would be very small. It would be maybe $5 a visit. And just know that other student health centers are already doing this. They're already charging the wellness fee and a copay. We've tried really, really hard not to do that, especially given that other of our partners are trying to get rid of a copay. We're trying not to get a copay. So we would really love not to have to do that. And then we would probably just increase by a percentage, just increase everything by a certain percentage. That's kind of the way we like to do things. So we're not picking and choosing certain tests over others.
Thank you.
You're welcome.
Looking at the ledger, or rather the financial statement that we have with us, there is an increase, money being allocated towards permanent staff. And I believe you mentioned that there is new acquisition of staff, but there is also less money being allocated towards student staff, from close to 100,000 to less than 1,500. Is that part of the strategic move towards better services, or could you elaborate on that?
So I don't see what you're looking at. What does it say specifically what it's for?
Student staff, salary and fringes?
Yeah, it looks like,
Where is it on paper?
Yeah, for fiscal year 27.
it's your student hours, if you still have student hours, in order to get carried on to the rest of your.
Oh, maybe not. And I don't have that in front of me to look. We'll have to look into that. It's most likely an error on the spreadsheet.
It was too little of an amount, I was worried, but okay.
We have time for probably 2 more questions. Seeing no question. No?
I actually had a question regarding what Mia asked about Medicare Medicaid. It's been quite frank, why would that necessarily be a bad thing about opening it up to the community since there's a certain population that might benefit? Is it because you see a potential increase in maybe the amount of people in the area that are needing that might reduce services for students, or?
So, I mean, when I say we'd have to open it to the community, I meant to Lawrence. So anyone who lives in Lawrence would, or even beyond that, would have access to the clinic. So they wouldn't necessarily be KU students, they would be everyone else. So when we're looking at things, the services that we don't mind offering to faculty and staff are those that are not being paid by the wellness fee, by the students. So for instance, we can allow faculty and staff to use physical therapy and sports medicine because LMH is doing their own billing. And so why would we not want to get them a little bit busier so they stay in the clinic? And so with this, the visits with our medical providers are at no cost to the students because of the wellness fee. So we wouldn't open that up to faculty and staff. So we couldn't open that up to the community and keep the staffing where we're at. There would just be no way.
Basically Watkins would be able to selectively serve students, but rather have to support all of
Everyone,
them,
yeah.
which would impede Watkins' ability to provide student care and probably lead to some administrative slowness as a matter of course. Is that the way to put it?
Yeah, and also when you're enrolled in those government programs, you also can't really turn anyone away unless you have a good reason for it. Like say they're abusing prescription drugs or they've been abusive to your staff. I mean, it's pretty bad stuff for you to turn someone away. So you would have to take anyone and everyone.
Well, that is about all the time we have for questions. Thank you so much.
Great. Thank you. You're all awesome.
Ellen, I fixed the file.
Oh, thank you. Sorry about that.
That's fine. All right, what's the question on 90 days? I want to make sure everybody understands 90 days. They
Okay, y'all, are you ready? Okay, we'll get started. I remember you did it, the air piece. Move to a different slide.
Okay. Hi, everybody. Hello. I know y'all been sitting here for some time. I am Jordan Brandt. I'm the director of the Student Engagement Center. First, I'll start with an overview about the Student Engagement Center, and then I'll get into our impact, which will lead to the questions that you all proposed that we answer. So, the Student Engagement Center, we are in our true first year of operating in the ways in which that we deem ourselves operating moving forward. We serve as the hub for student involvement, leadership development, impact programs and resources, and community programs. And I'll go through each of these areas. So first, starting where we're located, all of our services operate within the SMRC and then the Suite 400 of the Kansas Union. Just what is available for students within our spaces. Individual and collaborative workstations. We have a library with free printing, a computer lab, lounge chairs, lounge areas, massage chairs, reflection rooms, and again, just a space where students are able to host programs and events as they see fit. So who is on our team? So within our office, we have 13 full-time positions, but currently we only have 5 filled. We have 3 graduate assistants working in our office, 1 graduate intern, and 10 undergraduate student employees with 4 additional who are being hired this week, actually. So that would make our total of 14 undergraduate student staff members. So starting with the services we offer, starting with community programs.
Community programs is the branch of our office that oversees our student organization support, community programs, and then non-traditional student support. More specifically, we assist our students in finding student organizations that best meet their need through one-on-one consultations. We not only just oversee the registration process for student organization, but just the operation of our student organizations now on campus. We host this section of our office hosts our monthly graduate student dinners, which is a social opportunity for graduate students across academic disciplines to attend a private dinner within the SMRC each month. And then we offer resources and support for non-traditional students. And this is the area that is up and coming. Non-traditional student support across campus is a gap. And our goal is to help fill that gap by providing spaces and opportunities for them to feel connected to campus as they are navigating the university in a slightly different way. Moving on to our impact programs and services. Within this branch of our office, we have our campus cupboard, which is our food pantry, our pregnant and parenting pantry, and our clothing closets. Just an overview about how these services are run, particularly with our campus cupboard, a KUID is required. Students are able to visit once per week, and they are assigned 20 points per visit, and they can utilize those points on any of the items within the space. Our pregnant and parenting resource pantry, we have an online form for this pantry where folks are able to pick the items that we have in stock and select the time where they would like to come and pick up those items, and we deliver them in that way. And then our clothing closets, folks just come in during our operating hours and get whatever items at whatever quantities that they deem necessary for them. Moving on to our student leadership programs, this is the branch that is most really coming into fruition as we just had somebody start within the associate director position 3 weeks ago. So what you would see from the student leadership programs, particularly for this semester, our associate director will be hosting student focus groups that will really help identify what are the opportunities that would be helpful for student leadership programs coming from our office. What we do know is that our students are having some challenges with connecting their out of the classroom experiences to future career goals or furthering their education. Students on the campus are really involved, but we want students to be able to identify the hard skills and connect them directly with future goals so that they may be able to speak to those things when they are in the job search process or again pursuing post-secondary education. Some of the areas with talking to the team and also utilizing our student Senate advisory group that came up in that conversation was leadership speaker series, bringing back student retreats, student leader roundtables, multi-year leadership workshops, because we recognize what first year students need is very different from what our junior and senior students need, as well as our graduate students. One thing that came up was academic specific skill building workshops. Our members in our advisory board noted that within the School of Business and also in the School of Engineering, about them having a heavily focused office within their academic department that helps them with leadership development, but we're not seeing that across all academic departments. So how can our office support that? And then bringing back like student leader award ceremonies, which I can touch on in a bit. So leading to what the impact and then some of the questions. So first, you all wanted to know how many unique students we have served. So this information is from August 2025 to February 2026. So starting with our campus cupboard. No, and this is only for, again, only for students, the numbers that you see, the data that you see. So we've had to our campus cupboard 3,228 visits. And again, students are only able to visit, or everyone's only able to visit once per week. We've served a total households of 2,913. We've had 324 unique student visitors. Average number of visits per day is 45. Number of items we've distributed thus far is 31,754. Total pounds of items we've distributed is over 140,000. For our parenting and pregnancy pantry, we've fulfilled 22 orders. And some of this is because we haven't had items in stock to fulfill the number of requests that we've received. But the 22 have been the number of orders we've had the capacity to fulfill. Our office has hosted 311 one-on-one student meetings in person and virtual. And then student programming, we've had 366 unique students attend Fall 2026 events with 73 unique graduate students. Additional opportunities that we've been able to provide, national conference attendance for all of our graduate assistants. We offer a year-long paid internship for a graduate student. We've increased the number of undergraduate staff and to provide the same pay rate, and I'll again get more into specifics. We've been able to extend our operating hours of our facility and then increase the quantity limit for food items for our users of the campus cupboard. So in thinking about how do we incorporate student feedback, whether it's from student senate, advisory boards, other sources into our student fees. So for one, I mentioned that I had the opportunity to meet with our student advisory board who really honed in on leadership programs. Taking it back as a new office last year, we worked with the campaigns program with the School of Journalism, and from that came our KU Engaged office artwork, which is now notated on all of our information so students know who our office is. In spring of 2025, we conducted an annual report from users of the campus cupboard. And what we found was students thought that we needed to implement more dietary friendly items, purchase a freezer to provide more cold items. They asked for recipe cards to provide students with recipes from items from the campus cupboard. So we also now offer recipe cards within the campus cupboard that are most frequent items that our students are utilizing. They are able to, again, get the recipe card. We did purchase an additional freezer that we have in the space to be able to, again, meet the need of students, particularly asking for more produce and items and meat items. Implementing more dietary friendly items, we have been able to do so. Also from the campus cupboard feedback annual report that we did, students wanted us to have extended hours. So that is also what led to us wanting to hire more student staff than we've had in the past. In fall 2025, we launched our inaugural Reach Week. And at each event, we gather feedback from students to influence our ongoing programming. And this has led to the programs that will happen this spring semester. In our monthly newsletter, we have a survey at the bottom that includes for students to share their program ideas for our implementation. We've done social media prompts that have asked students to let us know the things that they're interested in. And then with the implementation of our one-on-one consultations, and this is why I notated that we had 311 one-on-one consultations. This is new and was not previously provided for folks to do one-on-one consultations, and we actually made the link for them to schedule those more accessible. So we've put it on the homepage of the KU Engage site, which is formerly known as Rock Chalk Central, because we know students are utilizing that webpage so they can go directly there and make appointments with our team. And what we've learned from those meetings, and particularly those are with students who are either interested in getting involved in organizations, but many of them were student leaders or involved in organizations, is that there is a need for storage space. That came up a lot, financial assistance, professional development, and professional development in the sense of there's been quite a bit of interpersonal things happening within student organizations and folks within those organizations having questions about how do they handle certain challenges within the organization and working with their peers, and then a marketing fund. So with that, it'll lead to this next question that you all pose, which is, which are the services would change most given an increase or decrease in the funding? I'm asking to remain flat. So if a decrease is provided, I think we will see the most impact to our campus cupboard. We have now been able, starting yesterday, we were able to allow students to get increased quantities of the higher priced items, which are usually the produce and any of our freezer items. We've been able to increase that. So with a decrease, that will probably, the campus covered would take one of the largest hits. Student organization support. What we found with our meetings is that fundraising is becoming more challenging and bleak for students to receive money through fundraising. And we want to be able to re-implement the organization financial awards, where student organizations meet various benchmarks, and then our office awards them by providing them funding that they can utilize for their organization operations. From the student leadership standpoint, one of the things our team is very passionate about is paying students for their labor. So we know that students want to hear from their peers, and our students are doing a lot of incredible things. So being able to offer student honorariums when we're doing those leadership opportunities. The next thing that would take a hit is professional development experiences, particularly conference experience. This year, we've been able to afford all of our graduate assistants the opportunity to attend a national conference that relates to their future professional goals, which is very new for just our offices. And I also was somebody who worked in one of the former offices. So this is a very new thing that we would have to just refigure out. And then we do offer paid internship opportunities. Well, we found many of our academic departments for graduate students require that the students are engaged in some type of internship, or if they engage in internship, it covers the credit of taking the physical class. And we were able to provide a paid internship. Many of the internships across are not paid. We've been able to provide a paid internship. And this year, our student is a student in the School of Social Welfare. Your next question, has KU hiring freeze affected the use of student fees? No, but the strategic hiring process that was implemented did cause a year-long delay within us filling those positions. So when I named that we have 5 positions filled and many of those vacant, part of that is a huge reason of the strategic hiring process creating that delay. And then you all offered what effect has the combination of the various centers at KU had on the student services and their usage? Quite frankly, we were able to provide pay equity across all of our student employees. What we found across the 4 departments that were impacted was that students were doing very similar things, but not being paid the same. So we were able to increase all of our student employees to the $12 per hour. So do pay equity across student employees. We were able to streamline our services, has expanded our reach for our students. Our unique student numbers, at least from the office in which I formerly worked in, was not this high. While we did have student usage and we would see the same students over and over, our unique student numbers definitely has increased with the streamlining. And then just expanding our services to operate, particularly in the ways of student organizations. We moved from this transactional relationship to have higher touch points with our students, which has then led us to be able to implement some of the pieces that I notated, because we're learning more information about what the students actually need due to those higher touch points. Okay, moving on. What would remaining flat allow the Student Engagement Center to continue to deliver on? From student community programs, like I said, our students are asking for storage units for their organization. Storage is, again, very bleak across campus. There's not a lot of space for organizations to host their items. So providing that, which means the purchasing of those storage units so that it's more robust and clear. Financial awards for our student organizations for their engagement within the KU community and meeting various benchmarks of participation and success to be used to support the operation of the organizations. A marketing fund, this came up in quite a few meetings, is that students are wanting to print flyers and event materials, but not having the funding to do so. And while our office does provide free printing, it's not at the capacity that student organizations are interested, or that we can actually meet the need just from the free printing that we offer, especially because they want to print in color. Something that is fairly new but is already on our radar is a homecoming parade for next academic year. Because we oversee student organizations and we very much understand that student organizations will be high participants. Within the homecoming parade, we do not want the financial burden of having the materials to be able to participate to be a barrier for student organizations. So being able to provide some financial commitment to our organizations for their participation. One of the other things, enhance partnerships with our student organizations to host events. That is something that we want to do. One, to limit redundancy across campus, but also to take off some of the financial burden for our organizations. From a student leadership perspective, some of the things I already named, because we would be implementing all new kind of leadership programs, clearly that would take finances to back those programs. And again, the student honorariums. If we're requesting labor from students, we would like to pay them. From an impact services perspective, what's important to know is that we had to decrease initially the number of visits per week for our students to be able to meet the need of the number of people in the high usage of the space. So initially we had students could visit 2 times per week, but then we had to decrease that number to 1 time per week because we would run out of food by Wednesday or Thursday. So we want to be able to offer the ability for students to visit more than once per week and then increase the number of points they can spend. So again, currently they can spend 20 points, but we would like to be able to increase the number of points that they can spend. Provide higher price items such as the dietary friendly food, and then the freezer items, the meat go really, really fast. So being able to provide that. From the pregnant and parenting pantry, these items are the most challenging to get donated because they're more expensive. So which means that we cannot fulfill the orders. So like I said, while we received numbers of requests, we were only able to fulfill 22 orders because initially we just didn't have the stock to do so. I didn't mention the clothing closet because we do receive a lot of great donations for our clothing closets to continue to run that. Generally office specific, I would like to maintain the number of undergraduate students on our team and continue to pay them the same across the board. Maintain our number of graduate assistants that we've been able to employ, maintain having a paid internship opportunity for some of our students to be able to engage in. And then the professional development funds. I think that is very vital for our students to be able to engage in development that will assist them once they leave campus. So, some water. Questions?
What questions we have? And remember to introduce yourself.
My name is Simran, I'm the chair of the representative. Thank you for your presentation. My question is regarding your effort to provide more money in your effort to help clubs fundraise. Have you explored the option of one day, one KU to these clubs and trying to offer that as an additional means of income?
Yes, so last year we actually worked directly with endowment to get communication out about Launch KU for One Day One KU. And what we found is that it was either organizations didn't receive funding, or it was is inconsistent, right? So we're not seeing that consistently student organizations are receiving this set amount to be able to operate, especially with the number of organizations that we have on campus. But yes, we worked with endowment last year to get some information out for a Launch KU to do One Day One KU for organizations. And then I think the other piece that's important, we do have some organizations have endowment accounts, but those are very donor specific, and it is from donors who have a direct correlation to said organization. And again, that number is less than 30 organizations that we oversee that have endowment accounts. And again, we have hundreds of active student organizations. So yes, and there hasn't been, I would say, consistency in what student organizations are able to receive through that effort.
Hi, good afternoon. Thank you very much for your presentation. Do you guys intend to request any fee increase for the next 2 to 3 years?
2 to 3 years? Not this year, not, did I?
2028,
In 2028.
2029. Do you guys have any urgency for request for increase, or you guys intend to remain flat for the next few years?
Yes.
Oh, great.
Other questions? Yeah. We don't have any questions. So this question is based off of the simulation files that we have in terms of kind of the finances for your group. It shows for us that for fiscal year 26 for this year, the other operating expenses are at around 200,000, and then for next year, fiscal year 27, it's jumping to 487,000. Is that correct? And if so, could you provide some context there?
Is that for my carry forward?
That was
No.
for the operating expenses where I'm seeing that. Because from my understanding, that is the,
It's a typo.
okay.
It looks like, we double typed something.
Okay, I was like, that doesn't seem.
We'll fix it.
Any other questions?
Hi, Robert, Community Representative here. A couple of years ago, we had some representatives from the campus cover come and talk to Senate about wanting a second freezer and also wanting to move into perhaps a larger room in Strong Hall. I was wondering if there's any plans with, renewing the unit if they were to get bigger space, and how you're able to acquire a second freezer in the current space.
So we do still want and need a larger space. If you have seen the campus cupboard, comfortably, 4 folks could potentially shop in there, potentially. So we absolutely, definitely still need a larger space. And I have been in conversation with my leadership, including our Vice Provost of Student Affairs, about what it would mean to, if we really want to have a campus cupboard that is truly operating in the ways to meet the needs of our students, we would need a larger space. So currently in the waiting game of what it looks like to acquire a larger space and where. As we know, space is limited currently. So yeah, still in that. And then your second question was about the second freezer. Like, where are we in being able to purchase that? Well, the problem is that we currently don't have a place to, if we purchase another freezer right now, we don't have a place to put it. So at this point, we have exceeded our space in our current campus cupboard. We do share a freezer with the unions, but there's not another space for us to, as we've been communicated, that we could put another freezer downstairs. We share with some of the other kind of union food operating areas. So space is, I would say, an ongoing challenge and an opportunity.
Let's go to Emily.
Okay, thank you so much for your presentation and for the good work you all do. Okay, I'm Omowumi, representing GSAP. I'm actually curious about the professional services. Is that what is allocated for the professional development that you talked about when it comes to leadership aspect of, okay.
So Both hands. So professional services, sometimes they're coded very interestingly, which is me and Casey talked about, and some of that is some of our like memberships to conferences or to professional organizations. But no, we also, sometimes some of our our graduate student travel does list under there. Really, that is confusing because it depends on how the SSC codes our items. But we include our professional development as far as like travel funds for our graduate students. It is in like the travel budget. Yeah.
Okay, that's eliminates my question a little bit, but I'm still curious checking through it now.
Yeah. In the travel line, that is where we include the amount for our
Okay, that
graduate
eliminates my
students to be able
question.
to,
Yeah.
to travel to conferences.
I was actually on PE last year, and so we took part in that whole reorganization effort. And so my question is, how has that been now you're out with it? I mean, I guess fully functioning, right? Could you just expand on how that whole rebrand works and maybe some things that got left out, or maybe some things that were in addition to it?
Challenging, right? Because I think about challenging from the financial standpoint of what does it mean to pull all these different cost centers and funds together that were operating very differently across the 3 different offices. So that, from that standpoint, I think challenging from a staffing standpoint, like I said, like challenging from getting the position filled, and some of that was just out of our hands of just processes that we had to work through. But now that we are, and then challenging, right? Because students, we wanted to meet the needs of all students and wanted to be able to communicate that and hear from all of the students about what they wanted to see now that those impacted offices were no longer operating in the ways that students in campus have become accustomed to. So I would say, quite frankly, quite honestly, very challenging in the beginning. I think now that we are a year out and we've been able to have higher touch points with students and reiterate like, okay, you're saying you're looking for this thing, this is how it looks now, right? Or this is what we plan to do to implement the things that you're looking for. I think that we are getting to a space that feels like we actually have a good foundation and something to feed off of, and things are being streamlined and students are able to know like the communication is a little more clear than what it was initially, or more accessible to find the services that they're looking for. But it definitely, I would say it definitely took the full year to get to that. And even like I said, this year we're operating differently just due to legislative pieces where now we're like, okay, we believe now, have we kicked off in the fall, that this is how we can move forward. And again, it has allowed us to have a good foundation to have a higher touch point with students and I would say an expanded reach than we had separately in the past.
Thank you. I'm glad.
Me too.
Kind of on the same line of thinking, my name is Leah, I'm Vice Chair of Community Affairs. And I'm just curious, I believe part of kind of the promise and package of the reorganization was that all of the full-time staff and kind of the number of student employees was to remain the same between those 4 departments and to the SEC. I think there was kind of a reorganized work chart. A lot of great planning going into that. And I'm just curious how you ended up with only 5 of those 13 full-time staff roles filled. Did people leave?
Oh, we never started with 13.
Okay.
So we never started with the full 13. What the new structure allowed us to do was create new positions that got us to be able to have 13 full-time positions. But all of the offices were understaffed and had a few people within them. So we never started with 13. And then from the student staff perspective, we were like, we've expanded. If we add up the number of students who worked within those 4 offices, we've increased that number this year.
Do we have anyone that has a question yet? We can go back to you.
that generated efficiency. So a lot of entities are explaining that salary is increasing naturally and they want to be competitive with the outside market. And so my question to you is, with the addition of these new positions, do you foresee maybe needing a salary increase to match the competitive workforce?
No, we were at market. Our position's already at market.
Okay, I know you talked about student organizations requesting for a space where they could save their items. Can you please elaborate more on how this is going to work, knowing the number of student organizations we have?
Absolutely. So we have in the Suite 400 hallway, there are, they were offices, but they're no longer offices. So we have currently 2 spaces that we've kind of self-identified could work as storage units, and we want to order lockers so that student organizations each year, information will go out to all of our registered student organizations, and it really is a first come, first serve. We clearly cannot meet the need of storing items at one time for all of our organizations. However, what we can do and what we've thought about is putting lockers within, we looked at Staples, which, KO approved vendor, and putting lockers within those spaces, and that student organizations would be able to sign up for a first come, first served basis, and that would rotate from semester to semester to hopefully give different organizations the opportunity to be able to have a space where they can host their items. That is not going to address the need, but it can help supplement the need.
I'm Nathan, the chair of the art subcommittee. I was curious about when you foresee filling those staff positions and if you would need any adjustment in your fee in order to do so.
No, I wouldn't need an adjustment in my fee to do so. And currently, we have the positions posted, one of the positions posted on KU website. So our goal is to fill them this spring. That's the goal.
What other questions, please?
Hello, Casey Sober, coordinator of staff. Thank you so much for your presentation. Admittedly, this question isn't too much in regard to the value of the fee necessarily. It's more so you've been in this center for a while now, and a full year has passed with it integrating the campus. And I really appreciated the numbers you provided about how many students are being helped throughout the academic year. I was also curious if you could speak to do you have any information about the diversity demos across campus in terms of who's visiting the center in regards to schools, classes, even like on or off campus housing, any kind of stuff like that? Is there any information regarding that, or is that not something you guys are able to track?
We are able to track it in some ways, but I don't have the exacts at the moment. Right now, what I have is undergrad and grad, like just the difference between classification. We're able to track it in some ways. One of the things we actually talked about is providing all of the unique student ID numbers to AIR to see if they would be interested or could offer us those breakdowns, because to that point, one of the things we want to make sure that where our students most centrally, who are our students that are mostly utilizing, and really it was from who's actually using our services and where do we need to go to meet them to tell them about our office, because one, we are very new in a lot of ways. So no, I don't have all the specifics on that, but it's not at the back of my mind.
Thank you so much.
Other questions? Seeing no questions, or Simra, do you have a question? No. Okay, sorry. Thank you. Okay, well, we have some time before our next hearing. Our next hearing is gonna be the Recreation Center at 4. So we'll take a little break, just make sure you're back here before 4. Before you get up though, just a couple reminders. Again, like kudos to everyone, y'all are doing great. Thank you for looking at the simulation files, thank you for asking really respectful questions. Just a reminder that if you're coming into a hearing, try not to come into a hearing late. If you need to, have a seat at the back of the room and just try to keep things as quiet as possible, especially in this room, because this mic will pick up basically anything. Yeah, and if we have any questions for any CFPs that we did not get answered, let me know, I'll pass them along, and then I can share that during deliberations. And I'm open for any questions at all. Go take a break, y'all, thank you.
No.
You're all good. I got my attention. Okay, y'all, we're about to get started.
I know.
Good to go? Great. Well, good afternoon. Thank you for being here. I know you guys have just a huge task ahead of you. And so I want you to know that we don't take this lightly. And we spend a lot of time on our presentation and try to give you as much information as we can to help you make successful decisions. So thank you from the beginning. My name is Jason Crone, Director of Rec Services. With me, you'll hear from today are Jill Yurkowski, our Senior Associate Director for Programs, Chris Wash, our Associate Director for Facilities, and Zach Lemke, our Rec Advisory Board Chair, which some of you probably already know. So they'll spend time with you. What we're going to do today is we're going to talk about what we're going to do. We're going to talk about what we've done, and then we're going to spend most of our time in the first session talking about that. And then in the very beginning of the second session, we're going to talk about our ask and then leave a whole bunch of time for questions. So we're not presenting for 2 straight sessions, but we do have a lot of information to get to you. This is a big year for us, and it's one that we've been pointing to for several years, and that hopefully will kind of come to light when we get moving on with our presentation. So, and then also just to acknowledge anybody who's online watching us as well. I appreciate you being here as well. So just very quickly, I wanted to just talk about our mission, vision, and values. These are things that help us drive decisions. These have been updated within the last 2 years, so it's not something that we just sat around for 20 years kind of sitting and watching and pretending that they're there, but they help us drive what we do. We talk about empowering Jayhawks to live a life of wellness. And then our values, we're even newer than that. We spend a lot of time trying to figure out what our values were, what were important to us, and why we felt that they needed to be there. And so those are our driving force. We had the great opportunity, and you've probably seen this with other student affairs departments, where we were reviewed by by NASPA, and then a professional within our association, NIRSA, National Intramural Recreational Sports Association, where they came in and reviewed all of our files, all of our manuals, everything that we do, how we do our budget, all of that kind of stuff. They talked to our full-time staff, they talked to our student staff, they talked to student participants. And in that, they gave us a really comprehensive review of what we do. And with that, they gave us about 50 to 60 recommendations, which is incredibly overwhelming. And so we spent probably 6 months in work groups and workshops within our full-time staff, where we kind of filed that down to what we thought were the 3 most important ones to focus on this fiscal year. One's about leadership development with our student staff, and we feel that's vitally important. Internal departmental communication, and we're using the KU Public Management Center to help us with that one, number 2. That's actually going to start with staff interviews here in the next month. And then a comprehensive style guide within just our department and our facilities, talking about branding and wayfinding. So those are a lot of kind of the behind the scene things we've done, stuff that doesn't get pushed out front very often, but we spend a lot of time on. So I thought it's important to pass that on to you guys.
How's it going, guys? I want to start off by thanking the Rec Center for allowing me come along and be a part of this. I think it speaks a lot to really the mindset of the Rec being a students first organization. I think the Rec Center plays a huge role in shaping the student experience on campus. I think we see a community that really starts at the rec that you can't really find anywhere else on campus. There's this idea in academia that's been talked about a lot recently, which is a third place, which is a place outside, home or school, that people can go gather and, really form a community. And I think the rec is in a very unique position to fill that sort of niche. One of the defining qualities of a third place is, that accessibility and openness, and everything, in the rec center that I see is, kind of done at a student's first mentality. I often have to give tours as part of my position as a facility supervisor. One of the things that I often say to prospective students is, just how much is available for them to be able to do at the rec. All of our courts, right? We have equipment for just about every sport that you can play there. We have a rock climbing wall that's free for students to go participate at. You don't have to pay for towels, lockers, locker rooms, anything like that. And it's truly a huge thing, making the rec center feel more opening and accepting to students. And I think we see that too as well with, I've noticed this year there's been a huge increase in students, even compared to last year. And I think that's a huge sign of students feeling like the rec center is a welcoming and opening place. I just think about truthfully that community that you can see in the rec center. You can find on any given night, maybe about 4 or 5 pickup games on one of our, basketball courts, right? And a lot of those people just go in there. They have no expectations of what to expect. They're playing with people they've never even met before, and it's truly a unique place for them to meet and interact with other students that you wouldn't really find inside of a classroom. Because in the classroom you have to pay attention to lecture, you have in-class work, right? It's really hard to find time to interact with your peers in a way that you can find at the rec center. I think that's really all I have. I'll keep it brief. Thank you.
Thank you, Zach. Zach definitely has done a lot at the rec center, from maintenance week of moving all the fitness equipment so we can clean the floors to being a building supervisor. So next I want to kind of look at where we're making strides towards our goals and thinking about tomorrow specifically. So one of the things that we had started working on actually way back in COVID actually happened, that there was a referendum, or a group that was students looking to do a referendum. And of course, COVID happened, so that changed everything. So now we're about 6 years out, and that conversation continues to happen. We're asked to reevaluate we had done a master plan back then, and we're doing we did another master plan in this last year. So we kind of want to give you the information that was provided to us through that master plan. Perkins and Will was used on campus for the master plan, KU master plan. And so we were able to kind of jump on with them and have them help us with this process. One of the first things we did was a needs assessment. And so we actually put it out to students to give us their survey or give us their feedback and understanding what their needs and wants were. The top 3 things for sure were strength training. These are kind of the themes that came out of it. Multi-purpose courts, cardio equipment, and then we asked them to look at repurposing some spaces. So we've known that the rec center is not big enough for the number of students we've had for a while, but like some of the areas that we have, we don't see high usage. So how can we make adjustments and changes possibly might be something we wanted to look into. So we worked with them in this process. I'm going to quickly go through some of the scenarios they came up with and some conceptual ideas. So scenario 1 is the smallest square footage. As you can see, the orange is like an addition right behind the racquetball courts, if you've been to the rec center. And that would essentially be like 3 fitness studio kind of stacked on top of each other. And then we would want to move, currently, if you've been to the rec center, we moved free weights and some barbell weighted, loaded weights into the Oriad Arena. That's not ideal. So we would also want to put a new weight room and combining the aerobic studio, our current aerobic studio, with the weight room, go through that wall. And we'll have some conceptual information sites here soon. And then changing the Oriad Arena into a multi-purpose court instead of an arena. So we take down the walls and everything and put down a different floor and have the ability for like badminton and racquetball possibly, or not badminton, badminton and pickleball, excuse me. Pickleball obviously has escalated and it's everywhere. And we also have a sport club now that is pickleball, and we have lots of students. So this would be kind of an idea of what it could look like if we did that. It wouldn't change too much, but kind of gives you some ideas. The next scenario is 3.2. It's a little bit bigger and adds a little bit more, kind of down into the grass area behind the rec center, which right now is a detention pond for all the water that comes down from the hill. But they would put that underground, so we would be able to use that space. So it would be the addition of multi-purpose court or gym, a new locker rooms probably, maybe moving the locker rooms up into that area where the orange and the yellow is, possibly a sprint incline, some small studios. We've talked about how people like to be in their own spaces, having cubicles maybe where people can work out on their own, when, you know, all these things that people like to do. Also a fitness terrace, and then even maybe some outdoor area where people could even work out. So, and then we got some estimated costs that go with that. This would be kind of the conceptualization from where it would be placed. So the double doors back there would be kind of coming from what our current building is. And then this would be the expansion. It could be that you would have, we could have like two courts. One could be wood floor and the other could be turf, where you could have practices of like soccer or intramurals uses it, or use it for sleds and things of that nature for fitness type workouts. So lots of different opportunities. The third is the largest of them all. And this one would be very similar to the others, so they kind of just add on to each other, where it would have some functional fitness in the gray area type space there. So, and obviously the most highest priced, of course. So that would be what it would look like. It would take out the outdoor basketball courts that we currently have, unfortunately, but it would give us a lot more space to do a lot more things. Obviously, Kansas weather is not always appropriate to be outside at all times. So this would be some conceptual drawings of what it could look like for the functional fitness space. Again, we could have sleds and different things in there. Open the garage, has like garage door type stuff. That's what a night vision would look like. Of course, finances are a huge part of all that, right? So you might be thinking, how does that work with what our situation is right now at the University of Kansas? And how do we address our goals, as well as the needs of the students that we heard in the master planning? Great question. And actually kind of how I went through it a little bit faster was because we actually do have a plan and we do have funding for it at this current moment. So we would be able to and plan to, unless there is a change to our fee, unless at our current levels, we would be able to implement this plan and are planning to go forward with it, unless financially things change. So we're looking at a 2,400 square foot addition, and I'm going to go through here and I have a little visuals for you. So the first thing is the addition outside of the martial arts studio, kind of the alley, if you've been in the rec center. That 2,400 square foot would be an additional aerobics studio. And then we would take on the actual aerobics studio, or martial arts, and change that into a second aerobics studio. So we'd actually have two. So we possibly could be doing lots of different things. Right now in the martial arts studio, the flooring is mats that are used for martial arts only. and we only currently have 2 sport clubs that are martial arts. So we would look at continuing to have those martial arts, but looking at rolling out mats. So it would be more flexible and able to use, and then use it for aerobics classes, yoga classes, those types of things. So we'd have 2 different studios, ability for more individuals to participate in those activities. The next space is the current aerobics studio and where the red is, and the weight room right now, where we have a lot of racks. And so the blue is the current, obviously, aerobic studio, red. What we would do is go through the wall, as I mentioned before, and then how that whole space would be where all the racks, all the dumbbells, all the preloaded barbells would be as well. So it would just make it more cohesive. Obviously, people don't just use one type of equipment when they're doing strength training. So it's a little hard right now. They have to be in the ORIAD, and then they have to go over if they want to use a machine weight somewhere else, and a dumbbell here and a rack here. So we understand that's not ideal, and we agree with you. So we would want to try to put it all together. So right now, these are like 2 pictures of what the space looks like. And this is kind of a general idea of putting them together, what it would kind of look like if we were able to go through that wall, and hopefully we can, or we know we can, essentially. The last space that we would then change and renovate would be the ORIAD Arena, like what I talked about before in some of the previous slides. And we would take on the dashboard system, which is the soccer system. We don't have that many individuals playing soccer in there any longer. And so that's why we actually changed it to be the dumbbell space, because we added more space and more people felt comfortable there. We also had some, individuals not feeling comfortable in our dumbbell space because it was so tight, and just the number of people in there and some things that could be happening in there. So we left them after COVID in the ORIAD Arena on the one side. So this would be the ability for us to have what I was talking about, pickleball courts and badminton courts. So we have a large number of individuals in the badminton club, who love playing badminton. Currently, we have two courts available that is either a racquetball or a badminton. I keep saying racquetball, sorry. Badminton or a pickleball court. So that's not a whole lot if you have a large group of people coming in the evenings to actually play. So this would expand that and also make it just a little more diverse. The last thing we would do is the little red dot you can see here is where the current cycle studio is. And we would take over one of the 2 racquetball courts that's over by the martial arts studio. Right now, we don't see a lot of racquetball playing, and we would still have 2 racquetball courts for the individuals to use still, so it wouldn't be going away. That would look like a cycle studio similar to this concept. It could be something that we would bring lighting in and give it more of an experience, and possibly even screens or something of that nature. Right now, we're just love to have it in an enclosed area, because right now it's open. So when they're having class, if you walk in the rec center during a class, I'm sure you know that there's a cycle class going on. The music's pumping and it's a little loud sometimes. I guess maybe that motivates people to be excited about it. But you never know. So that would give a little more ability for people to come in and feel more comfortable possibly as well. So next thing we want to look at is, why did we decide this? How did we think about this? Our goals, and how we're already performing. This is a lot of information I get. So we have looked at FY24, FY25, and then the difference is in the last column. I do want to point out that we have participants and participations, which are 2 different things, and I'm not sure if that happens in other areas, but participants are actually unique individuals, so we count them once. So if I buy a KU Fit Pass, I may take class 3 times a week. I'm participating or participations 3 times a week is where the participations come into. So unique individuals is always participants, and how often they come and take or use the program will be participations. As you can see, many of our numbers have increased. Obviously, there's some slight decreases in most, but anything that's 8% or above is our Rockwall, which are our programs. Our Rockwall, our KU Fit, our intramurals, and our sport club events have all gone up. I do want to say with sport clubs, we've actually changed and adjusted because we use a system called Do Sports Easy. And so we've been removing people after their fall year, after their fall semester, or if they delete or stop being a sport club, we take them out. So the numbers are being more accurately done. So that could also be a part of the small difference that we have there, but we'll continue to keep that more accurate going forward. But we feel like that's been great. So kind of looking at it overall, these are the last 2 years. So this was from last year's numbers that we shared, and this is from this year's numbers. And the thing with that is, so all those in the green box obviously are programs and areas that in the last 2 years have increased both years. Every single one of our programs has increased. And at some point, Jason will be talking about, we really haven't had any program increase in our budget for many years. So I also want to share for this year, it's kind of exciting. KU Fit, we do a free week at the beginning of the semester. So fall of this last fall, 25, we had 578 individuals come in and participate. Spring, we had 735 just this couple weeks ago. So we actually had 27% increase in the people who participated in that free week, which is awesome. Intramurals basketball season is upon us. They just ended on Thursday. We had 86 teams that registered with a wait list of 39 additional teams that wanted to be part of the wait list. Out of those 39, we believe we'll be able to accommodate 29 more teams by adding times, maybe a Friday at 5:45 or some different times that we haven't had in the past. So that's a 35% increase. So we're seeing that our programs are coming back, very similar to what we had pre-COVID, actually exactly. So that would be about 116 teams total for this spring versus 86 of last spring. So. And then unique student participants. So we do a report where we're able to see how many students came in out of the total enrollment one time into the rec center. Over the last 2 years, we've seen a 10% increase in the number of students that are actually using our facilities and coming in our front doors. Some other highlights, obviously, I've been giving lots of accolades to our programs, but these are a lot of different things that have happened in the last year. Sportsmanship ratings increased by 19% between the year of last fall, or February, not this year, but 2 Februarys ago, and that year later. Our sport clubs had 5, I think it is. Yeah, 5 national individuals go to nationals teams. And the women's soccer actually won their regional, so they actually earned their opportunity to go to the nationals. We offered, again, the 5K that we've done, and this has been our 3rd year, I believe it is. So we're planning to do that in the spring, and we're seeing good numbers and increases there. And then lastly, we just want to talk about, we're not the only people on campus we know, and there's other great units on campus that we can collaborate with and work with in providing wellness opportunities. So one of the things we do is we help with KU human resources by offering yoga instructors if they want to. We've worked with student unions, the student union activities, SUA, and done a yoga and pubs class also for de-stressing. And we have a program called Fitness Fundamentals that we worked with Hero through Watkins and the Student Engagement Center for them to understand. So we invited their staffs to come and learn and get that opportunity to go through the process essentially fitness fundamentals is an opportunity for people to learn about how to use equipment. So people who are intimidated by using equipment and never used equipment, they can come in for free and learn how to use it. So we were wanting to have them understand the process so they could share as a resource with others that they would interact with and students they would interact with. So we got great feedback from that.
Good evening, everyone. As Jason mentioned, I'm Chris Walsh. I'm the Associate Director of Facilities with KU Recreation Services. And so I've been with KU for a little over 2 years now. As you guys know, space is expensive and so is maintaining it. So there's a couple questions I hope to answer for you all tonight is just what is the actual cost of what it takes to maintain that space and keep it at the high standard in which you all deserve, right? When things break, how do we prioritize fixing it and how we go about funding that? And when we look at funding that, what is the gap between what we currently have and what we need to be able to keep KU Recreation Services running at the standard in which you all deserve? That's not working. Okay, here we go. As you all know, the Ambler Student Recreation Center, it's not just a gym. It's one of the most heavily used student spaces on campus. In FY25 alone, we saw over 408,000 total scans in the facility. As Jill mentioned earlier, she mentioned unique participants, but that was 408,000. That's the total number of time in which people came in and out of the facility, making it one of the most heavily used student spaces on campus. When you look at how the wellness fee breaks down, KU Recreation Services, we receive $73.35 of that. That makes up about 30% of that wellness fee. And why that is important is because that is vital for us to continue to maintain the quality and safe spaces that you guys all use when you utilize those recreation facilities on campus. Separate to that wellness fee is our facility maintenance fee. That breaks down to $3.15 per student. When you total that up, that comes out to $150,000 total. And when that might seem substantial, but as you can see, when I get into some more of these slides, you can see that's just a small portion of the pie for what it takes for us to offer the services at the level in which we currently offer them and we need to offer going forward. If you take a look at some of these pictures here, this is just a different look at some of our campus recreation spaces around campus. And all of these spaces, again, require their own unique set of attention to it for the upkeep. I'd just like to draw attention to the court surfaces. Just recently over this winter break, we were able to get all of our hardwood surfaces at Ambler resurfaced, refinished, which requires a complete buffing and recoating of all of those surfaces. That costs the facility a little over $23,000 just to have those hardwood surfaces done. And the recommended refinish on those is every 3 years. So that's a cost that will consistently be reoccurring for us over 3 years. In addition to that, if any of you, have you guys seen the Jayhawk courts just recently and the difference between what they looked like previously and what they look like now? Has anybody got a chance to notice the difference between that? All right, one of the things that you may notice with that is we did a complete refinish of those courts. We took them all the way down to the hardwood floor. And in the process of doing that, we repainted them, reorientated the Jayhawks to make sure that we incorporated the KU colors into that court. And if you go back over and you take a look at them now, you'll be able to see how vibrant and attractive they are in making that space very appealing to anyone that comes into the recreation center. When you look here, I like to highlight the turf field. We have 3 turf fields on campus that we utilize for our club sports and intramural sports. And with those fields, the approximate cost to replace one of those fields is anywhere from $350,000 to $500,000. The recommendation, industry recommendation for replacement on those fields is every 15 years, 10 to 15 years. Our central field right now, which is the field closely located to Ambler Student Recreation and Fitness Center, is nearing that 15-year mark, which means that's going to have to be replaced here pretty soon in the near future. In addition, just to make sure that we provide that safety for our participants that are using those fields, biannually we have impact testing done on those fields, and the cost to have that impact testing done on all three of those fields is estimated around $10,000 to have that impact testing done for all of those fields. Our goal is to be able to make sure that we avoid situations like this by being able to properly fund our maintenance fee, our facility with that maintenance fee, to be able to prioritize those high need things, so that we don't, push things like this down the road, and you don't walk around Ambler and see eyesores like this, where we have to neglect that, so that we can prioritize those higher need items. One of the big plans that we have that's coming up here pretty soon is going to be with the replacement and upgrade of our mechanical systems. If you look here at this slide, you can see that this is a list of all the major mechanical systems at Ambler Student Recreation Fitness Center. With those systems, the average life expectancy on those systems range anywhere from 25 to 35 years. Does anybody know how old Ambler is right now? Say that again. All right, so we're approaching 24 years, right? So what that means is that in the next 5 to 10 years, we're going to have some major repairs to those and replacements to those mechanical systems, right? And so that's going to be something that we have to address here pretty soon. The total cost for just those mechanical systems is $9,750,000, right? So that seems like a pretty steep number, right? But also, when you look in comparison to what we currently have, right, in that balance, the $340,000, there's a gap that's going to need to be addressed for us to be able to continue to offer high quality services to the KU
community. One thing that I forgot to mention at the beginning is we're throwing a lot of numbers at you. We're throwing a lot of ideas at you. We have everything backed up in our file folder that details everything out. So nothing that we're holding or hiding or any of that kind of stuff. All the details are there for you to be able to look at. And I'll talk about that a little bit more later on. So another part of our fee, and the main part of our fee is our operations fee. And this is what we spend and use for our day-to-day stuff. And you know this, but I'll just mention it one more time, is we, and when I mean we, I mean you guys, pay for everything that we do. Any kind of expenses that happen, you pay for. And so we try to be as strategic with how we use it and we spend it. But some of those expenses are just kind of day-to-day stuff. Anything from employee salaries to utilities. We budget for $325,000 just for utilities. So that's just keeping the lights on and the air on and the heat on and that kind of thing. But this talks about a lot of them. I do want to address one of the questions that you guys sent to us. We talked about what would happen if you reduce, if our fee was reduced. And what happens is that the things that can be reduced the easiest and the most efficient are all student facing. There's a lot of things on this list that can't be reduced. I can't reduce unexpected raises. I can't reduce university protocol, unfunded mandates, insurance, shared service center fees, administrative overhead, but I can reduce building hours. We can reduce the number of teams allowed to play in intramural sports. We can reduce the number of student employee hours that they can work. Those are the things that get cut first. And so that's in no means a threat, that's just the reality. Because I can't go to our full-time staff and say, hey, you've got to take a reduction in your salary at this point. So that just kind of helps maybe give it a little bit more background to that question that you had. I want to look at our revenue. And when we look at our revenue, this committee 5 years ago and 4 years ago and 3 years ago asked us how we could increase our revenue. When we came out of the pandemic in FY20, our revenue that we generated, this is besides the student fee, was $20,000. That was expected in the pandemic. But they asked, how could we increase that revenue? And so you can see we've gone from FY23 to 161,000 to last year 258, and we're expected to be above 258 again. In the past, this was about 7% of our overall budget. We're now approaching 10%. So 10% is the amount of money that we're bringing in from our programs, facility rentals, memberships, all that kind of stuff. And we did that by looking at several of our fees and increasing. So we've increased our membership rates for faculty, staff, spouses, domestic partners. We've increased our rental rates for outdoor equipment. We've increased personal training rates, all of that. And this past fall, we increased our intramural rate. We went from $20 a team. We went to an individual membership, $15 per semester, and then they can play all the intramurals that they want to. Last year, that generated about $7,000. This past fall, we generated $25,000 with intramurals. So we're expecting to generate probably about $50,000 with intramurals. KU Fit revenue also went up. That's just because it's a dang good program, and it's just been really attractive to students to come in and work out. And I say that because we haven't increased our KU Fit fee. This says 2003. I feel like it's been since I started here in 1996. That's how far I go back. That fee hasn't been increased, and so that's another one that we'll be looking at here in the near future. One of the things that we're going to be asking you to look at is our phase 2 bond. And so the building was built in 2 phases. The original was about 100,000 square feet, and then phase 2 is 50,000 square feet. Kind of on the backside where Joel's talking about the arena and the martial arts studio, that's phase 2. That bond retires in May of 26. So what is that, 4 months from now? And it's supported by $11.55 in fee. Part of our ask, we'll talk about kind of our ask with that fee, but I wanted to show you that that's getting ready to retire for us. I want to take a quick snapshot of how we compare to the other Big 12 schools and show kind of where we stand with that. This is the total operational budget that we have. KU's in red in all of these, okay? And to give you a hint and clue, we're going to be over on the far right side on each one of them. So you'll be able to find us really easy. The total operation budget, we're just approaching $6 million. The Big 12 average is we're just approaching $3 million. The Big 12 average is about $6 million. Dedicated rec fee, again, we're at $73 and whatever. $11.55 of that is expiring. So if no action is taken on our fee, we're actually going to go down even further than what we are here into the 60s. Average looks like is $85, $90, somewhere in there. Full-time exempt staff, we have 11. The average is right around 20. Total gross square feet of indoor space. Okay, so we have 150,000 square feet of indoor space. And my eyes are deceiving me, but Iowa State's way up there on the other side. What that master plan did for us with Perkins and Will is it helped tell us that for a university our size, KU, 25,000 students, we're 120,000 square feet short of indoor space. Okay, remember the building right now is 150. So almost double the size needed for a university our size. K-State's sitting almost twice the size that we are, just around 275,000. Total gross square feet of indoor space per student. Again, I think we're right around like 5.2-ish. The average is around 8, I believe. And the industry standard is 10 square feet 10 gross square feet per student enrolled. So basically what that telling us is that we're sitting in the bottom quarter of all of those graphs that I put you to, or I showed you. What I'm not trying to say is boo-hoo, woe is us. I'm not saying that at all. But I think I want to be able to tell you what the realities are. And those realities are is that we streamline what we do, and we use what we have to the best of our abilities. There's a lot more that we could do, but we do the best of what we can with what we have. We're at 42 minutes, and I believe we were scheduled for 45 minutes for a break, so we can break early. We can take 3 minutes of questions. I want to pass it on to you. I know we should have about 10 minutes of presentation after the break to talk about our ask, and then there'll be 2 minutes or 30 minutes of questions, whatever you guys want from that point. So.
I think we will do just a couple questions then over what we've covered so far, but keep in mind that there's still some presentation left. Listen.
Thank you for the presentation. My name is Simone, the representative from Rights Council. The question is on revenue, specifically with the World Cup coming up. Do you anticipate maybe you said soccer's dying, but maybe soccer's going to get revived? And do you think that could be an increase in revenue sales, maybe from rentals from those facilities?
Yeah, so we've actually talked about, because, and to maybe give a little bit more hint into that question, World Cup's coming to Kansas City. Lawrence is will be a host site for a country that's coming. I can't remember which one's coming, but one of them is coming to Lawrence. And when that happens, their fans come and base in Lawrence as well, or they base in that general area. I don't think it's going to have a massive effect on us, but what I think may happen to us is that we may get some demand this summer for some of our field space. They're not going to, the national team's not going to practice on our space, but the fans may, the conglomerate that kind of comes with them could. And so we've actually started talking about, what should we do with our rental rates? And should we maybe bump them up a little bit to help with some revenue? But I wouldn't say that that's going to be a major factor for us. We can also look at, and it probably won't happen because we haven't dived into this too much, but potential short-term membership to the rec for those that are visiting to come in and work out as well. So I think that's another possibility too.
I think we'll go ahead and break for 15 minutes, and then we'll go ahead and get started back here at 5.
Okay, thank you.
Great.
That one is, yeah.
Yeah, we're gonna get started.
I like the touch of that.
Okay, let's talk money. Okay, well, we're gonna, I'll talk real quick about our ask, and then I want to leave you guys plenty of questions as well. But I think we found a unique way that we're going to be able to address a lot of our needs and concerns while still being able to, while being able to reduce the rec services student fee in kind of totality there. I do want to start, before we start with the ask, is that if, and just to make sure that this is clear, if we have no increase to our fee, we will be able to operate for next year. So we can do that. But I think we have some needs within this that could help us operate better for next year. So what's our ask? $6. And with that, what we're proposing is that we continue to use $6 of the $11.55 fee that was for the bond retirement. So reducing that by using 6 of it, which means $5.55 of it wouldn't be used. That's the $5.55 that could reduce the rec services part of the fee. Tricky way of saying that. Okay, so how do we use it? We want to split it up into 2 different avenues. One is $1.90 for our operations fee, and the other is $4.10 for our facility maintenance increase. And I'll talk about how we do that from there. So for the $1.90 in our operations, it's in 2 sections. The first section is an increase to all of our program areas. And those program areas haven't seen an across-the-board increase for 15 years. And Jill spent a lot of time talking about how our numbers have increased, our participations have increased. They're continuing to increase this year. And so they're doing all that they're doing now with a budget that was back in 2010. The second part of the $1.90 increase for operations is to increase our line item for our fitness equipment replacement fund. And so we created that fund when we opened the building in 2003 to help cycle through new equipment, new cardio equipment, new weight equipment, all that kind of stuff. And we've used that same fee, same dollar amount since 2003. And during that time, commercial grade fitness equipment and cardio equipment has gone up 50 to 60%. Since the pandemic, it's gone up 25%. So those costs are just skyrocketing, and that fee has remained the same. So we're basically upgrading 2026 equipment on a 2003 budget. The other part of the fee is $4.10 for our facility maintenance fee, and we want to split that into 2 as well. Okay, so $2.50 of it for ongoing projects, and $1.60 of it to continue to increase our reserve for the facility maintenance. And I'll explain both of them here. From the program area, I've outlined, and this is one of the documents that I said is in our file, I've outlined all the way to FY44 for projects that need to happen or that we anticipate needing to happen within all of our facilities. And these are things like replacing rock wall flooring. That's in our FY28 proposal. In FY27, we need to upgrade our intercom system. And let me tell you why that's important. We've spent the last couple of years doing some safety upgrades, and our intercom system is another safety upgrade that we need to do. We cannot make an announcement in the building right now that can be heard by people in the building. It's just, the speakers are just terrible. And mainly you see that when we need to close, or if somebody's car gets hit in a parking lot or whatever. But what I'm really concerned about is if we have an emergency and we need to make an announcement in the building. And let's just say, heaven forbid that there's an active shooter on campus or whatever, we need to make announcements. We can't do that right now. And so that's in this plan. Along with the floor refinishings that are happening, locker room flooring, Resurfacing our outdoor basketball courts. That concrete is 25 years, almost 25 years old. So a lot of that needs to happen. Lots of cracks happening in it. Replacing outdoor court lights. We have what's called metal halide lights on our outdoor courts, which are very energy inefficient. And switching those to LED lights gives us a return on investment of 1 to 3 years. So return on investment means you spend money now, but in 1 to 3 years, we'll start saving money on energy costs for those lights. And so that upgrade could happen. Repainting exterior window frames sounds incredibly unattractive, but that paint is peeling right now. So all the red trim is peeling. That has to get repainted, or it'll start deteriorating the frames from it. So what we're trying to do is on some of these projects, we're trying to avoid what's called deferred maintenance. And that's just stuff that needs fixed that you just keep kicking down the road, right? And you just say, we can't do it this year, we can't do it this year, we can't do it this year. This plan helps us do a lot. And then obviously this kind of plan will have to be, I call it amoebic, meaning it has to potentially change and move depending on something. So if something, all the lights just break on the outdoor basketball court lights, we may need to move that one up, or we may need to move something back. So these are just examples, but in our files, it shows all of these detailed all the way out every single year, kind of what we're planning. So that's the projects part of it. The other $1.60 part of the facility maintenance increase is to help address those major mechanical issues that Chris was outlining. The AHUs, which is air handling units, CRVs, ERVs, which is energy return valves, chillers, cooling towers, all that kind of stuff. That's a $9.75 million expected expense that we think is going to happen in the next 10 to 15 years. If we don't increase this fee right now, we're going to be $7 million short to do that. What we're asking is to start increasing that fee right now, and if that's the case, it puts us $1.1 million closer to being able to handle all those kind of things. Now, we don't think all 17 air handling units are going to go out on the exact same year. That's usually not how it works. But if one starts going, the others are going to start going because they're all kind of about the same age. So those are the two different ways that we want to do. We want to take that $6, split it into two, and then take each one of those two and split it into two, again, to help us address a lot of our concerns that we have.
And remember, we started off with 340,000 in revenue.
That balance right now is 340,000, and that's when I took a snapshot of it in December. It's probably increased. If Casey were to look at that balance right now, it's probably more because we've received deposits in the spring semester already. But in December, it was that amount. So again, we talk about, we're just kind of showing all of our different activities that we do within the rec center and for students. I want to go back over what we believe is an incredible value for you. And again, when I said at the beginning that we take this seriously, I've been director for 9 years. I've been with rec services for 27, but in the 9 years, and even before this, but in the 9 years, we've never gone over budget. So we always are very conscious of where we're at. We run a very streamlined operation on a small budget compared to our peers, with fewer staff and smaller facilities. And we just believe that you've gotten a lot more for a lot less. And so we want to continue to be able to do that for you. And what I'm asking for you to do is the same thing that happened in 1998 when students said that they wanted a rec center in the first place. And they knew that they weren't going to be able to be here. Most of them weren't going to be able to be here when it opened, but they felt that it was a legacy item for them to say, Kaylin needs a rec center. Same kind of situation for you is that you have the ability to help students plan for the future with our rec center and plan for future operations changes, all of our major mechanical stuff, and you can do that all for less than the price of the Shake Smart Shake. Which, if you hadn't had one, come get one. Super awesome. Acai bowls are incredible, and they're my favorite. So come check it out if you haven't. That's our ask.
questions do we have for this round?
Thank you very much for your presentation. I'm Esperanza Montero, the upperclassman student university senator. And I have a few questions. My first question would be if you guys are able, since the rec center is so directly connected with athletics and wellness, are you guys able to get any funding at all from KU Athletics? And there are multi-millionaire sponsors like David Booth or Sean Williams, which I personally know them from my job.
I think endowment would tell me not to call up Mr. Booth and ask him for money because he's connected there. I will tell you that we have been very intentional for not mixing with athletics, and that may sound bad, but let me tell you why. Two reasons why. One, when the referendum was written in 1998, it specifically said that we cannot host athletic events and we cannot host academic events. And what that means and what that does is it allows students to be the primary and only users of our facilities and our programs. So I want to be very careful because once we start mixing, we may move down on the priority list. And I say that from experience from our peers across the country who may report to athletics or have a closer relationship with athletics, is that they then tend to move down the priority list when scheduling gyms or pools or fields or any of that kind of stuff. So I'm open to the conversation, but I want to be very careful that could open the doors to some things that maybe wouldn't be the best for students.
I have a follow-up.
Sure.
Well, can we go to someone else and then we'll go back to you? Okay. What other questions we have? If there's no questions. Go ahead.
Okay. Since you guys have such an audacious plan for the extension of the rec center, don't you guys believe that funding and from donors or endowment or KU Athletics wouldn't help fasten the process for such a renovation that would contribute to assist all students, not only the teams in athletics?
So we are engaged with endowment to a certain degree. And I've had meetings with endowment reps before so that they know what our needs are. They may not be actively going out asking for an expansion to the rec center, but I like to say that they have back pocket projects or projects they keep in their back pocket. So when they're talking to a donor and that conversation may veer and they may find somebody who may be interested in wellness or may be interested in whatever, they could then say, oh, well, we have these opportunities with rec services, with fields, or with facilities or whatever. And then probably to kind of piggyback onto that, we do have a good relationship with endowment because the field that we have at 23rd and Iowa, we call it the super field, the big 2-field turf field or whatever, students paid $0 for that. And I think that's part of the relationship that we've had with endowment because that land is all endowment's land. And since I started here in 1996, we always knew that we were going to lose those fields at some point for endowment to do other projects. They're now doing some of those other projects, but they said, hey, we want to help you and we want to build these fields for you. So we've got 2 lighted turf fields. So yeah, I'm happy to have that conversation. I can tell you that I think we're pretty dang close to being able to announce one very significant donation to rec services from a donor, but it's not at the public stage yet. But it's significant.
I'm just going to say, my name is Simon, the Rights Council representative. Quite frankly, if the facility and operation fee was kept flat with the removal of bond, and I did calculate it, so 61.8 was would essentially be, what would that do? Would it maintain the status quo, or would there be a reduction in services? Could you just provide that info?
Yeah, we could operate as we have for 1 year. And that's what the simulations would show is that for FY27, I believe our balance is around 60,000, 63,000-ish for the end of FY '27. 63,000 sounds like a lot of money, but when you have a almost $3 million budget, that's basically a flat rate. So yes, we could.
Yeah, thank you so much for your presentation. And my name is Omomi, representing GSAP. And I must really say that the Rec Center has been of great resource to students as it has grown over years. And in terms of even allowing students to have access to a lot of facilities in the Rec Center, even for free initially, and then I know some of those resources has been monetarized now, which I feel it's okay, to generate more income, at least at a minimum price. So, but my question is, and I must really say thank you for that. So, my question is the minimal expansion aspect of the proposed expanded project. If that is done, is that not going to impact the other intended expansion that is on slide 12, slide 15, and slide 17? If the minimum expansion on slide 22 is done, how is that going to impact this other proposed expansion if the opportunity comes up?
Let me make sure I understand your question so I answer correctly. I think what I hear is if we do this, when we do this, how does it affect one of these?
Absolutely.
Okay. This will be hard to do, and I don't have the correct numbers, but to fund $39.6 million for an expansion, I believe was $50-some in student fees. And you will know this better than I. I feel like I have maybe a pulse of it, that I don't think that's within the appetite of students to say, hey, we want to increase our fees by $50-some, right? And so you go down to the next one, it's $35-ish, and you go down to 3.1 and it's $32 of increase. One, students have to be willing to pay for it. I don't think they are. Two, the university has to have the debt capacity to be able to take on additional debt. And I don't know if that's the case. We've got $800 million of construction happening at the football field. And so the university doesn't have the capacity to, even if students say they wanted to do this. And so what we've done with 2.9 is we've tried to address as many of the recommendations that Perkins and Will had in the smallest amount of money available, smallest amount possible to do it. So they had 4 recommendations. All 4 of those recommendations can be addressed in some small part with this. Could they be addressed way better in 3.3 with $39 million? Absolutely. But in today's time, in today's condition, I feel that this is the best way to start trying to address some things, because it's also helping. We're also utilizing underutilized spaces in the rec center better. That arena is not being used to its fullest extent. Our martial arts studio is not being used to its fullest extent. Our racquetball courts are not being used to the fullest extent. And so we're addressing all 3 of those with this plan here. Did that get to your answer? Question?
Yeah, but my thought process is just that I understand that this is the current reality of what you can work with related to your budget. But what about if another opportunity comes up in some years to come? I know you don't want to, a debt cannot happen at this time and all of those, but what about if it does come up? Does that mean this will be demolished to be able to achieve that?
No, I don't think so. I think what we would add on would just complement what we're trying to do with 2.9. So I said a whole bunch of stuff, and I could have just said that. Huh? Yeah. This wouldn't take away from 3.1, 3.2, or 3.3. We still would need those.
Okay, other questions?
Hey Edgar, I was wondering if, like, the fee that we grant you this year is going to impact the 2.9 renovation, or is this happening regardless?
This will happen regardless unless our fee would be reduced. Our operations fee would be reduced from now. We had reserve from the original building, and we anticipate reserve happening from phase 2 that we can use to fund this, with the exception of about $235,000. And $235,000 is in FY27's budget and simulation without a fee increase. We would use $235,000 from FY27 to be able to do this. But if our fee was reduced, then it could put some of this in jeopardy.
And that doesn't include the bond removal, correct?
Yeah, I'm talking about if we're not even talking about our ask, our $6 ask, we can still do this. Our $6 ask is not connected to this.
How's it going? I'm Henry. I'm just curious if you can provide some more commentary or some detail on conversations you've had about the retirement of that bond, and if you think there's any appetite to take on more debt in the future.
I always say that taking on more debt falls on the shoulders of students and falls on the shoulders of a student or a group of students saying, we need this to happen. Because it's received much better from students by their peers, as opposed to administrators who have been sitting around for 27 years going, you guys need more rec center. You guys need to increase the budget. We need $40 million. But if you or your peers go to your peers on campus and say, hey, we think this is really important, it gets a lot more feet, not only with students, but it gets a lot more drive with administrators as well. Because every director of a department says we need more money, or we need more space, or whatever. So we're constantly talking about that. But that's how it started in 98 is Kevin Yoder was a student body president. He basically went into the vice provost's office for student affairs and said, we need a new rec center and I'm going to help make it happen. And he put a group of about 20 students together, and they spidered out to all kinds of student organizations talking about that. So I think it has to be student driven, or it could go. And I say that because that was in 98. In 96, there was a more massive referendum that went to a student vote for a 230,000 square foot rec center. And it was voted down 70% no, 30% yes. When Kevin Yoder and his group did it 2 years later, it flipped. And there was a 70% approval by students for that.
Were you also asking about the universities or just?
I took that after the answer to the question.
Okay.
Hi, thanks for your presentation. My name is Mia, and I'm the representative from Community Affairs. I was just wondering, so it seems like regardless of the fee that you were given this year, there will need to be some sort of increase down the line to account for that deficit, just in terms of the maintenance that around 9 to 10 million for all of that electrical and heavy equipment. So I'm just curious if you could address a little bit about why it seems that your prioritization level currently is kind of expand first and then save if you have extra.
When there was surplus from phase 1, originally it could only be used for facilities, and it couldn't be used for programs, it couldn't be used for operations or whatever. We continued with that thought with the surplus from phase 1 and want to continue with that thought for the surplus of phase 2, because we may not get this opportunity again for a long time. We could certainly use that money to extend our operations, but there's very rarely a time where we're able to say, hey, we can take care of this. And so that's why we've come to this plan this year, is to be able to say, hey, we can add we're adding, from a square footage standpoint, we're not putting a lot of stress on those air handling units and that kind of stuff, because we're only adding 2,400 square feet to the overall footprint. But yes, it could be used potentially could be used. I think I'd have to ask for permission for it to be able to be used for something else. But right now we've said that we need it, because it was generated to pay for a facility, we should use it for a facility.
I have a question concerning liability and safety of personal items. This is a situation that happened with me. I had a personal item stolen at the rec center while I was working out this summer, and unfortunately the staff was not very attentive nor cooperated with my needs. Within that request that you guys will have for the future for a renovation, will you guys invest anything regarding security, such as security cameras or a better service regarding future occurrence of those acts? What do you guys plan regarding the safety of the students, their personal items?
So one, very specifically, 60,000 is earmarked for additional day use lockers. So all those lockers that have the combos that you can put on, we know we need more. And so that's one item. The second item that I would just say is that if you feel that you didn't have enough attention put to your item that was stolen, that you can elevate that. If it wasn't elevated to a facility supervisor, which is Zach's position, certainly can be elevated there. If you don't feel that it's been addressed appropriately, then it can be elevated to our full-time staff. We have 32 cameras-ish. We have one pointing to most of those locker systems, if that's where it was located. So we certainly can. Public safety can also address those. I would say that right now, we don't have a plan to add more cameras, but we've added them in the past. The most recent would be the aerobic studio and the weight room. And those came from direct, hey, I don't feel quite as comfortable as I should in these spaces. And so we put cameras into them right away. But even with like the intercom system, safety and risk management, those are high priorities for me. And so they'll continue to be seen. And I'm sorry that you had that experience. That's I hope, not the norm.
Our staff would not be able, our student staff is not able to look at the cameras. So they usually require you to contact public safety, and then public safety can then look at the cameras to assist.
The staff at the time that the incident happened to me, they didn't even say that public safety was.
Let's make sure we're asking questions.
An option,
And then,
okay.
you know, we can talk
Okay.
stuff.
Okay.
Yeah, what other questions do we have?
And the other thing that we've done before is that if we see where we think a theft happened, we can actually backtrack them with cameras all the way to the point where they checked in, and then be able to identify who that person is.
So I know recently the Shake
Shake Smart.
Shake Mill.
Shake Smart.
Yeah, Shake Smart. Yeah, they actually started operating in the rec center, and I was wondering if that space is like an additional revenue space for the rec center, and if that is, what are other opportunities that you all have thought about to expand on such collaborations that could enhance external revenue, including maybe outdoors rentage, or even other people using the facility besides maybe what are those other options?
Sure. Right now, there is no revenue sharing for the Shake Smart facility because it's run and operated by Dyna through the unions. And they need to make sure that that's a viable unit for them and that it's making money for them. And then Jack and I have already talked about, once that's occurred, then we'll start talking more about how we could get part of that pie as well. I feel that it was just an important piece to add to the rec center. I've been trying to do it for 12 years, get a Shake Smart here. And so my initial reaction was, let's get it here, then we can talk more about revenue sharing. Other spaces, when you walk into the rec center, over to the right, you'll see a bunch of glass windows and walls. It used to be our administrative office. We're hardly using that space at all right now because most of our transactions are happening online. I've had some conversations with Jayhawk Community Partners about what we could do in that space. And they're talking about kind of back pocket type of projects. They're also out there actively looking to see if there's any community partners out there who may want to use that space. And then if they were, that could certainly be a revenue source for us. And then we're also using Jayhawk Community Partners. They're, what's the subsidiary of Jayhawk Community Partners where we use our for camps? Anyway.
Through the special events, hospitality.
Yeah, through hospitality. So there's a whole new department on campus that their only goal is to go out and find camps and groups to be able to use university spaces when they're not being used. And so our summer is full of KU basketball camp. There's 3 sessions of those. KU volleyball camp, 2 sessions of those. Cheer, dance, almost every single week. And so they have helped us fill up all of that space, which has helped us with our revenue. Our fields have been rented as well. The balance that we have is we could schedule something every single weekend, tournament, whatever. We could schedule that every single weekend in all of our spaces. We could schedule youth basketball practices in whatever, in all of our gyms during the course of the week. But we've protected those spaces because we want students to be able to use it. I mean, how disappointing would it be to show up on a Wednesday night and you want to play basketball and there's a youth basketball team, on that court. And so we've protected when we rent out our spaces to the times when students aren't around as heavily. And so that's why summer is just such a big time for us to bring in those spaces. So that's what's increased for us, and that's how we've gotten to that 258,000.
What other questions? If we don't have any, I can ask them real quick. So I was curious on slide 84, that one with kind of the green bar, even with the increase and kind of the full ask, there's still that large maintenance deficit. Do you anticipate needing more increases in coming years to close that gap?
All caps, yes. There's really one thing that keeps me up at night. Risk management's not one, because I feel like we do a great job. Our programs, we have staff who do a great. This keeps me up at night. What are we going to do if all of a sudden we have catastrophic failure in some of those units? I don't have an answer for it. The university doesn't have a pool of money waiting to give to be able to replace a chiller or whatever. So this keeps me up at night. So today is step 1 to try to say, hey, we got to start preparing for this. You need to start preparing for it. Otherwise, we start kicking that can down the road with deferred maintenance. It's going to stack up. And the longer you kick it down the road, the more expensive it becomes, too. An air handling unit that may be $350,000 today, 10 years from now, maybe $400,000. So yeah, yes.
What other questions do we have? Seeing no questions, thank you.
Thank you. Really appreciate it.
Thank you all. Our last hearing for the night will start in 10 minutes. It'll be KU Memorial Unions. You can exit the room if you'd like. Just make sure you're back here before 5:45.
Yeah, one more.
Good evening, everybody. How are you all doing? My name is Jack Credo. I'm the executive director of the KU Memorial Unions. And I have brought four of my closest friends tonight to help me out through this. And if you would permit us to let me have them introduce themselves, that'd be great. Brian?
Good evening. I'm Brian Broxman, Director of Facilities and Event Operations.
Mike Ayers, I'm the CFO.
I'm Sloan Smith. I was the previous director of SUA, executive director.
And I'm Casey Fuller. I'm the KJHK station manager.
All right. So before we get into the presentation, if it's possible, I want you to put yourself in a situation in your mind, all right? Either think of it from your viewpoint or think of what I'm about to say from the viewpoint of someone you know. All right, so it's your first semester at KU. Maybe you're far away from home. Maybe you're not. Maybe you're just from Kansas City, or maybe you're from Lawrence, and you don't know anybody at the University of Kansas. And so tonight we're going to tell you why the union is so important from that viewpoint. The KU Memorial Unions allow people to make connections, have a sense of belonging, and create a sense of community. And how I'm going to end it, I want you to think through the same viewpoint later on in the presentation of you or someone you know on how I end this presentation. But we really do believe that our organization creates that opportunity for people. And you could think of countless stories of seeing people that met their best friends either at Union Fest or Tea at 3 or at the dining facility or anything else that we operate. We love our organization. It's a fantastic organization, and we're proud to provide the service here at the University of Kansas. I want you to get three things from this slide, if you will. This building, our vision is that this is the campus's living room. And we're going to talk a little bit about that later today or tonight. But look, if you don't know the KU Memorial Union, really we are called the KU Memorial Corporation. We are a 501c3 business, right? We're about a $45 million revenue generating business that provides all the things that we provide: dining, bookstore, student programming, event spaces, etc. It is key to highlight that we do not receive any state funding or any other funding from KU other than the student fees that we're here tonight to discuss. We operate 26 locations throughout campus. You can see it on the map. I'm sure you've been to many of them. And then what we're going to highlight once Mike gets up here and we talk about our financials, keep in mind that student fees provide the unions about 7% of our revenue. Without this 7% revenue, we really cannot provide the services that we're going to lay out for you tonight. Here's our mission. You can read it. I'm not going to read it to you. But the things I really want to highlight, what this is saying, is that we do create a sense of belonging, space for belonging, and a space for community. And we really do believe in this mission. Down to the newest employee, this is what we impart on them, and that this is what we are here to do. I've been the union director for about 2 years now, coming up on 2 years. And our senior leadership team and I sat in a room and we said, what is it that we are doing? What is it that we're going to provide? And if you really concentrate on the middle column there, lines of effort, these are the 6 things that we concentrate on every day in order to provide the best programming, the best service, et cetera, et cetera. And you can see each of those 6 things. Tonight, each of those 6 categories, we're going to lay out our presentation and how we're getting after and what is so important for student fees to enable those 6 things to happen for us. And then our end state, right? You could read that, but really what our end state is that we want people to be here. And we want to provide that climate where people want to be here. We don't want the union to be a place where you have to come. We want a place where you want to be here, right? You either have, right now, we think you have to be here to get something to eat, have a meeting, maybe something else, but we want you to come here and hang out and be a part of this great, great building, and as well as our entire organization. So this is our fee structure. Up front, I want to let you know that we are asking for a flat fee. We're not asking for an increase to our fee. We're broken down into two major categories. Fee 514, it's the Birds Union, and that is to pay the lease off for the Birds Union. And this was approved by Student Senate years ago. The agreement was that this fee will pay for the lease as much as possible through 2040. You'll see later on when we talk about the Birds Union that still the union uses some of its cash to pay for the expenses that the fee does not cover for the Birds Union, but we'll get into that. Fee 520, Kansas Union Operations, you can see the price there, or the amount that we receive. We'll go into that. The Kansas Union Repair and Improvement fee, we have it kind of moved over to the left because we really want to highlight that through this presentation. And then the student union activities and KGHK is wrapped up under operations. And then we take that money and then we pass it over to those two organizations. So engagement. Remember, one of the lines of effort that we have here are inviting spaces. I'm going to have Brian Broxman here talk about a little bit about our traffic into each of our buildings and why you see the numbers fluctuating year over year. But you can see the Kansas Union is a very important building to our community. Brian?
Thank you. So talking about the unions, we're really talking about the Kansas Union, DeBruce, and Burge. Between those three, we're generally almost 1 million people, or if not over 1 million people coming through the doors every year. That's amazing amount of people that we get to touch, and we get to try to make them feel part of the community. So like Jack said, one of the things that we see, we are going down a little bit. Part of that is contributed because we also track how many people go into the bookstore. We're seeing a lot of people doing ebooks more than they are hard books, so that's cutting that down. We still are trying to recover from having no football on campus. So those two things were really the biggest part of what we lost.
And you can see at the DeBruce Center, you see a decrease there. You know, we changed our dining plan to more of a swipe system this year than a declining balance system. And so where people are eating, those traffic patterns are changing, and they're most likely going to, Mrs. E's South Dining or North Dining, which we don't capture on this slide here. Our people, another line of effort, and we're really proud that we provide an opportunity for students to work with us, and you can see the impact of that. 906 student jobs over in 2025, roughly $1.8 million in student salaries that we paid them, or what the students have earned. 78% of our total part-time workforce are students, and none of these earnings are from student fees, just to highlight that. Outstanding service is very important to us. We sent out a survey earlier this year. I think 767 people responded. You can see 80% of the survey respondents thinks the Kansas Union provided them a sense of belonging. And then you can see 80% of the respondents that they feel that the unions provide them a sense of community and connection. And so we're proving that this is vitally important. Engaging programs, you're going to hear from student union activities and KGHK, but you can see what we've hosted. 52,667 touch points. That's not individual, unique people. That is, maybe I went to 10 events, I got counted 10 times, but 52,000 connections is quite the remarkable number of what student union activities, KGHK, our dining, our other programming, what we're providing for the campus. Really, really proud of that. Union Fest is an incredible event every fall in August, and you can see this year we had 12,000 attendees come to Union Fest. Our team can tell you, this is where I think of the stories of where people met at Union Fest in line for a game or at a table, an event, and they said, oh, you're interested in this, I'm interested in that, what's your name, this is my name, and they become lifelong friends. We definitely have those stories that we know of, and that's such a special connection that we love. The big event, another program that we run, you can see 2,774 people signed up to provide community service to the Lawrence community. Just something to be really proud of. And then esports, they're small but mighty. I mean, for a very small organization, it does not receive student fees, but you can see 3,000 people in attendance for one of their Smash tournaments with 100,000 people streaming. So, this is a very, very, very busy place. Back to inviting spaces and what this really highlights, I'll let Brian talk about it again, but I want to say, since we can't tell you on how many unique people we provide a service to, this shows the student population versus the non-student population that are using our spaces. Right?
Very good point, because to take it back to the traffic, we don't know who, what, where it's coming into the building. All we can try to determine is that many people actually came into the buildings. This is a better representation of who's using the spaces. Between the three buildings, we have almost 40 rentable spaces that students and outside entities can use. As you see, we're a little over 12,000 room reservations for FY25. That's a little bit down, but I am happy to report that as of fiscal year, this year to date, we are almost 1,000 above fiscal year 25 at this point. So it definitely shows that buildings are being used, and we're striving to meet what our mission statement means.
Before Mike talks about budget management, I do want to say one thing. Right? We are a revenue generator, but that is not our sole mission. Our sole mission is what I've already said. I think if people want to be here, they're voting, right? Ultimately with their time and their energy, and then where they want to spend their money. So our first mission is to provide programming and that sense of belonging. I think sometimes we get wrapped around just talking about the money piece over and over, right? Because it kind of makes this union operate. It makes it go, right? But I don't want to come across as that we are money first, people second. We are students, faculty, and staff first, and our guests first, and then the rest will follow, right? It's like if you build it, they will come. And so please take away that we are people first. Mike?
Okay. Now your favorite part, we get to go through some numbers. Let's start with just a quick overview of our 4 revenue generating businesses, if you will. Dining, the bookstore, of course, student fees while we're here, and then catering and events. I want to give you a bit more background. So in dining, 25 over 24, we were up 6%. Bookstore, we were up 4%. Sorry for more percentages on top of percentages, just trying to give a perspective. Dining revenue is about 18 million. Bookstores around 12. Student fee is around 4 million. And then catering and events is 3.8, something like that, so pretty close as well. If we look forward to 26, dining is going to be down just a little bit. Part of that is based on enrollment. Big part of our dining revenue comes from first-time freshmen, and we were down quite a bit versus what we expected. I think we were down, 300 first-time freshmen year over year. Our bookstore is down. We've been struggling a bit with Apple sales, our tech sales. Good news for us, it's not a high margin, but we're working to get back in the game on that, stay relevant. Student fees is about flat. And catering events, just reiterating what Brian said, we've seen 1,000 new events, and our catering events has rebounded because year over year, 25 to 24, we were down 19%. Some of that was football off campus, But that wasn't the only driver. But we're rebounding some. I don't think we're going to get back this year, but hopefully next year we'll get back to our 24 run rate. So if I look forward, just in general, some of the headwinds I see against us are first-time freshman enrollment. I mentioned that, and tech sales. But we got some good tailwinds behind us. One is, I think, for the first time in probably 3 years, we're staffed at a good level, full-time employees with our dining. We're focused on quality, variety, and experience in dining. I think it's showing based on how many people are showing up. And I already mentioned that catering and events is rebounding from last year. Feel free to ask questions anytime. You go to the next slide. You got the Jack? Okay. So a couple things to note on this. I mentioned $4 million in student fees. This view here only includes the operational fees. We also get about 1.1 million in R&I, which is repair and improvement fees. And those never flow through our income statement, but we book them into our reserve account and spend them as we do projects. Brian's going to talk about what we're going to be doing with that money soon. We currently have, just to set it up for you, Brian, 1.5 million in our R&I fund. We won't have that very long if you look at what's going on down on the 4th floor. If you look at 25 over 24, I already mentioned the revenue item. Our expenses were up. One, we had a bit more revenue, I mentioned in 25 versus 24, so that comes with cost of goods sold. Think about food, books, even though you don't own anything for a digital book, we still pay a fee for that. There's costs to that. And then we had we were up about $1 million in payroll, largely from getting fully staffed up and full-time employees, plus just general increase in wages and health insurance. Our health insurance was up 17% last year, and this year it's up another 17%, so that's a big chunk. And then finally, we had boring accounting stuff. We had to write off some old receivables that flows through that net income statement. But if you are into accounting, great. If not, I understand why. But you should know that the cash you receive is not necessarily tied to your net income statement. So in 2025, we netted 3.2 million in cash, operating cash. With that, we had to spend 2.5 paying down debt, and another, 2 million paying down debt, and we had another 300,000 in investments in capital improvements around here. So we really only netted 900,000. My goal is to see the union spend money wisely. And I think about 4 big channels that we focus on when it comes to how we spend our money. Mitigating risk. This is a 100-and-some-year-old building. You see there's a leak on the roof over there if you walk by, or you may have noticed it out there with all the tiles. By the way, we're responsible for any repairs in this building. KU doesn't pay for it, state doesn't pay for it, so things like a roof, a broken pipe, whatever that happens around here, we fund it out of our cash reserves, and sometimes out of the R&I fund. I'll come back to that. We like to fix things when they're broken. Second big stream. Third big stream is repairs and improvements. Brian's going to cover that. And then finally, enhancements. I don't know if you've had a chance to spend any time or at least walk by the Jayhawk Inc. I'm seeing more people hang out down there, especially now with the project going on. But we put new carpet, light freshen the place up, got rid of all those books that have been there since 1973. And I think just made it a more good place to hang out, including some new furnishing. Is there any questions you guys have for me? Oh, I want to reiterate one thing. So you mentioned we paid students last year $1.8 million in payroll. Our total part-time payroll is only 3.8. So that's almost half of our total part-time payroll. So I just wanted to highlight that.
Thanks, Mike. Just to go into some of the fees a little bit more, Bird's union fee, we talked about. The fee generates about $785,000 in FY25, goes directly to that loan. But there's about, you can see that it doesn't cover the entire loan. We still pay for that out of our cash reserves as well. That's the so what of this. And I think the agreement runs to 2040, not 2048 is what I'm, even though it says 48 on this slide. Kansas Union fee. The R&I portion of this is where I think we have some time to talk about this. R&I fee is really student fees that should go back into this union in order to pay for things students are going to use. And during the time in COVID, we were using R&I, which was approved by the Senate and the university to use that for operational money. We are no longer doing that. We are in a good spot financially that now we are reinvesting the R&I fee back into this building for things students can use. And you can see that firsthand of what's going on the fourth floor. That's about a $1.6 million project. That's going to bring in a better, nicer coffee house and the campus's living room, and there's going to be a fireplace and more comfortable seating. And this is where I'm talking about maybe, hopefully, and I think it's going to work, where students want to come to the union, and that will be a place to hang out instead of just a random chair and a table and not so much comfortable seating. So we're really excited about this. This is going to be complete in May, between May 1st and May 15th. But we had some student feedback. We had a committee that sat on the design phase of it. And this is what we believe is really good use of the money from the R&I. Our plan is to use the R&I fee, which Mike told you was about $1 to $1.1 million a year, to reinvest that money back into this building. And you can see some of the projects that will happen in 27 and beyond. A ballroom refresh, third floor student dining area that has green furniture for some reason, right? Why doesn't it look and feel like KU? Why isn't there KU branding? It will with the R&I fee. Woodruff Auditorium, we're looking to brand that as KU, so when people come and use that, they feel like they're in KU and not just a big blue room, right? Union flooring to make it a little bit more cohesive as we start doing the fourth floor. And then all of our restrooms need to be redone because they're not in good shape. And I really do believe this is a good use of the R&I fund. You can see some of the things have already happened. We started the $1.6 million remodel. We did a $40,000 upgrade to Jayhawk Inc. And then we invested $20,000 in the Divine Nine room, which was musty and cold. And we just redid that over a Christmas break or winter break. New carpeting, new paint, took out old radiators that had a mold issue. So money is being spent wisely, as Mike said we like to do. Here's just some pictures of what the fourth floor renovation is going to look like. You can see it's branded. Here it's going to be, if you didn't know, this building is about to be 100 years old this year, and it was built as a World War I memorial. And so right now the memorial is on the 6th floor stairwell. We're going to have a more prominent memorial to the World War I veterans that lost their lives to the war, all 130 of them. That will be on the 4th floor in the main Jayhawk Walk area to pay the respects that we think it should. But we're really excited about this. We're partnering with the same company that did the Welcome Center and did some of the interior designs at the football stadium. So really excited about that. KU Union Operations. You can see the fee generates about $1.7 million just for this building alone. But annually, we have approximately $2.1 million in expenses. And so the fee doesn't cover all the expenses for this building. And just to remind you and hit the point one more time, we receive no state funding to operate this building. So it's from our revenue as well as student fees. So that's the money side of it. And really what the more important thing is let's talk about student programming, really the fun stuff. And so I'd like to bring Sloan Smith up here to talk about student union activities.
Yes, okay. Hi again, I'm Sloan Smith. So student union activities, our mission is we are the main entertainment hub for campus. We serve all of the Jayhawk community by bringing a diverse selection of events to all students. Through this past year, we've reworked a little bit of how we want to bring events to students by reducing the quantity of events that we are doing, but upping the quality of the events. So we are a team of student leaders, and we wanted to reflect that into our event processes and really bring the mission to students. So what we've done is we still have the union as our main hub, but we have events spanning all over campus now to hopefully reach all types of students. And we are still keeping, we have anywhere from 1 to 3 events per week, and this is backing off from where we had about 3 to 4. So not too much of a decrease, but we're just upping, trying to redistribute the money to up the quality a little bit. And then this has worked out well for us. We send out a survey at the end of every semester, and in our past semester survey, we had over 90% of attendees rating our events significantly high. We also are reaching our mission by connecting students to campus, with over 89% of people strongly agreeing that SUA helps them feel more connected to the community, which is huge. About 40% of students that attend our events are coming to meet new people or to enhance their college experience. So just our organization is enhancing a college experience for the entire campus, for the entire university. And then highlighting again Union Fest with over 12,000 attendees in the fall. That is our largest attendance number yet. So that is making connections for 12,000 faces on campus. We also collaborate with many different departments on campus. Here is just a list of a few. Our goal is to continue fostering these partnerships while also building new connections to keep reaching and supporting all types of students. All right, and then you saw this on a previous slide, but we had 193 events at FY25, and then that reached our 52,667 touch points. So if you look at that bar graph down there, that's right in line with where we were in 2024. Just to highlight why there might be that discrepancy. So we've got still like the less events quality, but in 2024 with football being at Arrowhead, we were busing students. And so all of the students that we were busing counted towards those attendance numbers, and we were busing over hundreds of students for every home football game. So we did see quite a lot of event attendance for those events, but still without having to bus students, we were right in line with where we were last year. And then 42% of our attendees live off campus. I think this is crucial to note that we are bringing people who don't even live on campus onto campus to engage with the campus community. They're not just here for class, they are a part of campus as a whole. And then 8.1% of our attendees are international students, which is keeping in line with where we've been for the past couple of years, really reaching to engage all student populations. And then here's a breakdown of the budget. So most of our event costs are going to be in our events needs category. So hospitality is all of our food purchases, anything that we've been serving to students at our events, talent fees, gotta pay the performers that are coming to campus, same thing with the leases and the rentals, anything that's required for a sound system, a stage, other smaller events that need rentals, and then overall event supplies. So we're in the business of making memories, and so we need the supplies in order to give students those memories. And then a smaller portion, of course, is marketing and PR. So those are our event flyers, anything we're doing online, social media wise. The number one way students hear about our events is through print advertising. So that's going to be a large portion of our marketing costs. And then smallest is administrative costs. So again, we are a team of student leaders. So that's going to cover our professional development, any office supplies, inner spaces, anything along those lines. And then we just wanted to note that while we are a team of student leaders, we are paid through scholarship through a separate endowment fund that is not part of the student fee.
And I'll pass this off to Kate.
Hello, everybody. I see some familiar faces, so I think some people might be familiar with KJHK, but if you are not, I'm Casey Fuller. I'm the station manager, which means that I am the student manager. We have one person above us who's Bobby, who's our general manager. Other than Bobby, all of our students, or all of our employees are students who work at the radio station, so it's entirely student run. I could gush about KJHK for hours, but I will try and keep it to the presentation. So yeah, we're a non-commercial education license. That means that we don't fill our airwaves with like advertisements for anybody who would pay from it. We do offer a free PSA or spot on air for every student organization, which is our attempt to try and connect with the KU community a little bit more and offer that opportunity for other student organizations. We're on air 24/7, 365. Currently for, we're still getting the numbers on this semester. The last semester we had about 90 student DJs, and that doesn't even account for our other volunteer staff. So we have quite a few folks who visit us every day. We are on the third floor of the Kansas Union. If none of you have visited, please do. I would be happy to give you a tour. Up here it says we have 24 stipend student staffers. This is, I think, from our summer numbers is the 75 volunteer DJs. We offer a variety of different staffs like content, sports, street team, music, and multimedia. Those offer students the opportunity to learn about a variety of different areas in media. It's a completely a learning opportunity. You don't have to know anything coming in. Goodness knows I did not. We do awesome little things like sports broadcast. If you ever wanted to, do commentary on air for like KU basketball, we do that on the court side. It's really fun. We added 3 new staffs this year. We have an archive staff, which is our archival staff member, Bella, who is going through all of the physical media that we have in the station. IT staff and creative, all of the designs of our posters and stickers are student made, and we love that staff very much. We invite people to come in and design their stickers with us. We've been nominated for 13 awards with the International Broadcasting Systems, which is a conference that is held in New York City every year that we've been attending for quite a few years now. At this point, we usually do very well. In 2024, we were voted best college radio station in the nation, and we've continued to do very, very well at that conference. We're going again in like 2 weeks now. Best college station in the nation. We also celebrated our 50th birthday this past semester. We had a music festival that spanned across several Lawrence venues, and we had over 1,000 attendees for both the student population and the Lawrence community, which is amazing. We have Micah and Lauren who planned almost the entire thing on their own. It was a great time. So with that, we're trying to increase our volunteerism in the community, offering promotion spotlights to student organizations, and championing creative ventures for any KU student that walks through our doors. We just want everybody to come in and learn something. It's a very welcoming community, and we strive to be that sort of hub for creativity at the union, but also at KU. So this is our listenership. We are a radio station, so this does matter a little bit. We have a mobile app that we developed a couple years ago with our IT director, which has also won an award. And this is the numbers for our downloads. In 2024, we had 8.5 thousand total downloads. That went up for this past year. We put out a survey across campus, and the majority of our listeners say that they listen through FM radio still. The stream started an additional sports stream for volleyball and soccer coverage so that we can have our sports staff and DJ staff sort of on air at the same time without needing to choose one or the other. So that gives people a chance to choose what they would like to listen to. Here's the numbers for our online stream. At the moment, it's a little bit more difficult to get that like FM number, but this is our app numbers. We also have all the photos of our different volunteer staffs. We have some sports staffers. This was us in New York with all of our little awards that we got. I think that year we won I think we were nominated for like 30 things or something like that year. That would have been my sophomore year, and then some of our creative staff did some projects together. So this is a small breakdown of our financials. We can always go over it in more detail, but just for the sake of representation, our fiscal year, 2025 budget was about $165,000. Our staffing cost makes up 61% of our financials here. Our operating cost is about 22%. Running radio stations is not cheap. Development communications, which is just that's going to be mostly what we use to go to these conferences. Paying for hotel rooms. There's another one we go to that changes location. It's called CBI. I think last year was in Denver. And then station maintenance, equipment repairs, again, not cheap equipment, damages very easily. And then our licensing costs with the FCC, and then all of our like things we need, like Zeta, which is what our system runs on to actually put music on air, makes up 2% of our budget. If you have any questions about that later, either Jack or I can answer them, but this is just a small breakdown. But I think that's it from KDHK, Jack. I think this goes back to you.
Thank you.
Okay.
Yeah. So if I were you, I would sit there in your seat and say, why should we fund SUA and KGHK? Here's my answer, and we can get into it during the question. Students are asking for things to do on campus. Students are asking for, big events, people they know to come and provide some type of performance, right? SUA and KGHK are, in my eyes, literally the arm that can make that happen, right? They are bringing performers to campus. They are creating connection and belonging. SUA they are bringing people to campus to do things, right? They're one of a few organizations that are widely looking at the entire campus and trying to bring things to do for all students. Now, are acts and talent, is it getting more expensive? Yes. Are we going to need partnerships? Yes. But they have the staff, they have the planning, they have the know-how to make that happen for the things students are asking for. So that's my answer to that. I don't know what the two of them would say, but probably get that opportunity. As I leave you, I want to leave you with this. I asked you to put yourself in two scenarios. If you could think of a time when you came to the Kansas Union and you were just, observing people around you, hopefully you've seen just two random people running into each other that maybe met a year ago, or maybe met 2 months ago, or maybe they just share a class once and they run into each other and they have a big smile. I've seen it countless times, and then they grab lunch together and then they hang out, they catch up, and this is our space. This is our organization that allows that to happen. But I will also say thank you to the Student Senate. Your leadership allows everything that we've been talking about tonight to happen. You are creating a sense of belonging and a sense of community on our campus, and we truly appreciate your partnership. So we'll end it there, and we'll take any questions that you have. Thank you.
What questions do we have? Okay, is it all right if we use that microphone?
Thank you for your presentation. I'm Kate, the IA. You spoke a little bit about this in your presentation already, but I was wondering if you could expand on when you expect, like, say, the bookstore revenue to, like, go back to what it was, or like what you guys are doing to increase the revenue.
Yeah, I'll start, Mike, on that. It's a fine line. You're either going to increase revenue or you're going to make more money in a bookstore by doing a couple things. You're going to increase prices. You're going to cut costs. You're going to cut costs. You're going to find a new way to do business, or you might have to cut people, right, to make the numbers work. Well, we don't want to lay anybody off. We don't want to raise prices. We definitely don't, right? We hear students, it is expensive to buy books. Sweatshirts are expensive everywhere, right? And so we don't want to make it more expensive. And so we're thinking of new ways to do business. And so the bookstore's coming up. Alex Todd, our director, is trying to be innovative. And now we have a t-shirt printing business. And so if you want your student group wants a t-shirt and you have a design, they'll print it for you. And it's probably cheaper than like a t-shirt anywhere else. Right? She's trying to be innovative and do new ways of business, or reduce inventory and be able to print a t-shirt. Instead of buying 50 t-shirts, we'll just print them one at a time for what somebody wants, right? So we're trying to think of new ways to do business so we don't have to raise prices. For books in itself, the publisher is setting most of the prices, and we're trying to keep that price as low as possible to support students. Mike, if you want to add anything on that?
A couple things, just trying to take Houston more business intent. So I mentioned we're suffering a loss of our Apple products. I have a daughter that goes to a different university. I failed on that one, but I bought her a computer at the bookstore because I wanted to support the business. I don't expect everybody here to go buy it there and spend another $50 because that was the price difference. But I want to make sure that we present. The good thing about buying it there is if there's a problem, you take it right there and we have this tech support right there on staff. You don't have to go find an Apple store. You don't have to ship it off someplace. You don't have to return it through an Amazon thing if something goes wrong with it. So we just need to do better about presenting what we offer. And the other thing I would remind you all is you all save 20% anytime you go to the bookstore and buy stuff. So go check it out. And then finally, I think we need to look at the inventory and make sure it's still relevant. But where it's not, let's figure out what would be more relevant to what people want to see.
Yeah, I would say we're challenging the status quo of how we're operating the business as well, based on what Mike says. But, you know, the bookstore is really unique because it also supports students. So if you bought a t-shirt or a sweatshirt down there, hopefully one of our employees have said you want to round up, right? That roundup is going back to students in order to support. There are students out there that can't afford their textbooks. You know, we are, I think, Bailey, I don't remember the number off the top of my head, but, you know, thousands and tens of thousands of dollars are going back to students to buy their textbooks through a scholarship fund that roundup program goes, right? We're trying to have prices, students get 20% off all the time. And so for us, it's not always about how do we make more money, but it's also this, and this sounds so cliche, but I'm not trying to be, we're also trying to support the needs of our students because we know, you know, things are expensive enough. So. Putting you on the spot, Bailey.
Thank you very much for the presentation, Ms. Esperanza, Student University Senator. My question is quite peculiar regarding the cleaning of the facility. As I am aware, the Memorial Union has 2 janitors at the moment, Mary and Nelson, who work one in the morning, afternoon, evening. How would it look like for you guys to pay one more janitor if that happens in the future, hypothetically? Would you guys need from the student fee, or it would be from your revenue from your corporation?
We have more than 2. Those are the 2 most popular. Great ladies. And so I think on the day shift, we have 3 full-time.
Yes.
And then we have a night shift in kind of like a swing shift, but we also contract the whole night cleaning of the building out to a corporation, Jana King. And so they do all the night, the stairs, the floors, the bathrooms. And then Mary, Nelson, and Stephanie are through the day, you know, keeping up with trash, restocking bathrooms. And we absolutely know that that's one of the things we're concentrating on. We know we can do better on cleanliness throughout the union. Things like better flooring, no kidding, what we're doing on the 4th floor, that is easier to clean than the tile floor we have now, the grout. We just spent $20,000 on cleaning all the grout in the building because it probably hadn't been cleaned in 15 years. But the type of flooring we put down makes it easier to clean, makes it look better when it is clean than the type of flooring we have now. And that's why we want to redo our bathrooms, because they're hard to clean. They're old, and there's a lot of stuff that has seeped into all that we're trying to do better, right? So believe me, Brian is always looking at what is our staffing. We're okay with it right now. But yes, if we were to get another staff member full-time, it would come out of our cash. I don't know if you want to add anything to that.
No, that's what I was going to add, is that it comes out of the operations fund, not the R&I fund.
Hi, thank you for your presentation. My name is Julia from the Community Affairs Council. I was just curious, I know you had mentioned that there was recently a switch in how the dining plans operate and what's offered to students, especially freshmen who are, I believe that they're on campus kind of mandated to have one of those plans. I know there was a huge problem in the past with students having a bit of a surplus towards the end of the year, and I was just curious if the new plan has changed that at all, and if so, how any of those changes have affected your revenue.
I can certainly talk to you about that. I could answer all that question. Just know that there's a clear separation here between the student fee discussion we're having and dining plans are not student fee focused. And so I don't know from this standpoint, we want to take time to talk about dining plans that aren't student fee, but I'll highlight it quickly. So we have time to answer anything else that is student fee focused. The new dining plans address that problem, that there is less money as a surplus at the end of the year. We had two plans that were just declining balances. $2,400 on your balance, you spend it, you don't spend it, at the end of the year, it expires. Now all of our plans have some level of swipe. Unlimited swipes, 14, 10 swipes. And then the unlimited has $1,000 of dining dollars. The 14 meal plan has $600 available, and the 10 meal has $300. So there is less opportunity to have excess funding at the end of the year because we know that is an issue. And so the new dining plans address that directly so that students are not, and I'll just say it, wasting their money at the end of the year going to the hawk shop. So this is our first year with that. We'll see how that goes, but there should be less of that.
Okay, I'm sorry. Just to clarify, did you have information on how that's affected your revenue? Because I believe dining was about half of your 54% of your revenue. Has that had the time to take an impact on that percentage?
So we're still assessing that. Where the increase in dining revenue comes from on a separate process. We go to the Kansas Board of Regents, and based on our expenses and operating costs, we ask for an increase in dining plans. Over the last 2 years, it's been a 5% increase just because of what Mike had said. Cost of goods sold, food that we buy, people that we pay, it's getting more expensive. And so that's where that increase comes from.
I think it's the right representative. And so my question, I have another question, but my question this time, so it's actually with the slide recognizing the partnership between the memorial unions and student senate. And so my question to you is, with us also being the Verge, is there any opportunity in the future for student senate to have a more stable way of renting rooms in the unions? For example, I know this year we've had a lot of issues with fluctuating rooms, booking rooms, and coming from the student senate perspective, it made no sense since we have offices in this building, but we seem to not be able to hold many council meetings. And so my question is, would the union be willing to honor potential permanent reservations for student senate to conduct our meetings, with little to no issues, considering our long-standing relationship?
Yeah, I think that's a great question. In my mind, I'm sitting up here and I probably don't have all the information in my head to answer you why it is that, but you should have first right of refusal to the Alderson Auditorium, right? That's the student senate chambers. After that, I think that's a broader discussion of what exactly are you looking for specifically? Like, do you always want the Malott room, right? We do, in all transparency, we get a level of funding from the provost that allows students to book the space without charge, right? And so because the provost is paying for students to use this building from a cost perspective, right? I think anybody could say the same thing. The provost might. So I would say first, let's start with Alderson. That's the Senate chambers. You should always have that. And we should work around that so that we're asking versus you're asking to use your own Senate chambers. After that, I think we've got to have a more sit-down discussion on exactly what that looks like. Great question, though. Makes sense.
Okay, thank you so much for the presentation. Yeah, my name is Omom, representing GSA. I know that from your presentation, you said the KU Memorial works in partnership with Verge Union. And I know for the alumni welcome building, it's like a different entity. But correct me if I'm wrong, maybe I'm just overthinking things. You also mentioned that the company that actually helped in building the welcome are going to also assist in some aspects of the memorial. And I know they charge for the welcome building, even for student organizations to use them. So am I overthinking this, that there could be a potential charge in the future?
The company I referenced was the architects and the design team who is going to make the 4th floor look like the 4th floor looks, right? The Burge Union is a student union. It is, we don't partner with them. It is us, right? I don't ever see that we would charge students to use the student union, right? This is your union. They're a separate company that's technically off campus, right? That building. So they don't get reimbursed or they don't get a provost fee, right? They're not getting money like the union does from Senate or the provost for people to use this building. So that's why they charge. On campus, this is KU's building. This is your building, so we're not going to charge students. Did I answer your question?
Okay, absolutely. Yeah. Thank you.
There's no questions over here. We can go back to, or let's go to Charlie. No, we can't throw these ones, unfortunately.
Not quite as easy as the catch boxes. In 24, you only had $24,000 worth of bad debt expense, but that jumped up to 520 in 25, and you're projecting 300K for this coming year. Was that a particular account, or was that just a change in how bad debt expense is calculated?
Yeah, Mike, go ahead on that one, but I don't know if that.
That's a good question. So first of all, I should have said it earlier. We absorb all bad debt of students. So somebody goes into the bookstore, buys their books, then decides that they need to leave for whatever reason, they don't pay the bills. We don't get anybody from KU for that. So that's part of it. And I've been here a year and a half. And when I got here, I noticed we weren't really putting up any bad debt reserve really anywhere, which is not a good practice of any business. So the 300,000 that we projected was for two things. One is for the bookstore, because we have found that we're not collecting everything that we bill, because like I mentioned, students have different plans. Second, the 500,000 was a cleanup. There were receivables on our books from like 2014 from students. We're not going to see that. Frankly, I think what happened is maybe there was some wonky accounting back in the day. They got the cash and you clear the receivable. But anyway, that's what that is. And then the 300,000 this year is to try to get us to a place where we can then put up a smaller reserve going forward, but then have money out there so when something happens. And so we don't have over expectations of what revenue we're going to do.
Yep.
Little lesson in life, always have a Mike Ayers on your team.
Are there? Yeah.
Well, as for KJHK, do we have any concrete user or necessarily outside of the app downloads?
So the way that FM, oh, I'm sorry, Jack.
Go, no.
Should I
Have
use
Casey
that
in your
mic?
life too.
So the way that FM statistics work is that the FCC will not release that data or even really collect that data unless you pay the FCC or it's a different company under the FCC. It's about a $40,000 charge to ask them for FM data, which we just don't. Well, we haven't been able to justify that type of large scale purchase when we have other things going on. So the best that we can do is just send out a survey to the community. A lot of that is just like campus-based, whatever students are willing to answer. As far as the exact percentage of students that responded to FM, I don't have that right off the dome, and it was an oversight to not put it on the presentation, but in the future I could probably get that number for you. Obviously, our app data is a little bit easier to get because it's our app, and we can just see how many downloads there is on the the App Store. But yeah, so FM data is a little bit more difficult to get. Was there another part of your question, or is that about it?
Beyond just the app downloads, is there any way you can track like user retention or how people are interacting with the app?
That's a really good question, and I think that's something we could add. Right now, it's a very rudimentary app, just sort of meant to give people the music that we're streaming. Right now, our IT director is improving it. For context, we've only had the app for about 3 years. Our previous IT director, Alexis, made it his first year, so it's still something that's very new to us. I could definitely bring that up. That'd be something very interesting for us to see. We do know primarily that just based on like, maybe this is more anecdotal, but a lot of our downloads come from alumni who are checking with the app, and then a lot of our downloads come from parents who are trying to listen to their children's set. So, but yeah, it would be great for us to get more of that information, but right now it's still kind of at a rudimentary level.
Is there anything else? Can I run this to anybody?
Do we have any questions for anyone who hasn't asked a question?
Robert's question.
Thank you guys for the presentation. You all are doing some impactful job. My name is Frederick Omai, graduate student body president. I'm curious if KGHK is receiving additional funds from probably School of Journalism, something like that.
So no, we do not receive any funding from any department on KU campus. We are directly under the student union, and that is very much by design, so that KGHK is student voice and not department voice. So no, we do not receive any funding from journalism or any other sort of school department on campus. Sorry, Jack, I don't mean to keep taking the questions.
This is great. No, you make my life easy.
Can I toss this mic to anybody else? Did that answer your question? I'm so sorry.
Yes.
Okay, awesome. Who else?
Robert?
Is it for Casey?
Hi, Robert, Community Affairs Representative here. Thanks so much for talking about your presentation. The input from students is something that we really value here, especially with this new design. Just want to note the 50% membership requirement of voting rights for students in all boards and committees of the union. So I was just curious about our goals for next year to make sure that we're reaching that 50% mark of student representation.
Yeah. Acknowledged. No, I think that's important. I think it's easy to overlook. And, you know, I'd like to talk to you a little bit after this to maybe expand on that aspect. But yeah, anything that's done in our buildings, we should have a student voice. I think area for improvement on it, you know, we sat down with the last administration, we talked about the renovations, we got their input. But could we improve that from student senate input? Since you're representing students, absolutely we can improve that. There's so much more to do in our spaces that need that student input. We will definitely do better.
Thank you.
All right, y'all. Well, that is all the time we have. Thank you so much.
Thank you. Appreciate your time. You got me on that one.
I've been sitting on that one for a long time.
I like that.
Okay, it's just something in our constitution. It's something that I think was established back